Good afternoon. I'm calling this hearing to order for the Committee on Health, Land, Justice, and Culture. I'm Senator Joanne Brown. I'm the Vice Chair of this committee, and I'm sitting here this afternoon on behalf of Speaker Therese Terlaje. Today is February 12, 2024, and the time is 3:02 p.m. With regards to public notice in compliance with the open government law, notice of these public hearings were published in the Guam Daily Post and posted in the Governor Guam Public Notice Portal on Monday, February 5th, 2024. The 5-day notice was provided, and on Friday, February 9, 2024, the 48-hour notice was provided. Notices were also sent by email to all senators and all main media broadcasting outlets. This hearing is being live streamed on the Guam Legislature's YouTube channel. General rules of conduct. Individuals testifying shall first be recognized by the chair before speaking and begin by stating their name for record-keeping purposes. In an effort to minimize distractions while someone is testifying, the committee asks that those present please be quiet and refrain from moving around the public hearing room. Additionally, we've asked protocol to keep the doors quiet. Individuals who are presenting oral testimony are invited to submit written testimony afterwards in order to ensure that their input is accurately transcribed. After testifying, panelists will only be allowed to speak again in direct response to questioning or an invitation from a senator who has the floor or at the discretion of the committee chair. After all have testified, senators will be recognized for 5 minutes of questioning of the panel or comments on the bill and shall not interrupt any other senator or any person testifying. This hearing is to collect testimony, not to debate or to engage in back and forth arguments with the participants. Berating of any witness will not be allowed. If you ask a question, allow them to answer. Agenda items. The item on today's agenda is Bill number 162-37 LS, introduced by William A. Parkinson, Thomas J. Fisher, an act to amend Section 3218.1 of Chapter 3, Article 2, Title 10 of the Guam Code Annotated, and repealing relative to updating the Women's Reproductive Health Act of 2012. I'd like to acknowledge my comments that are present today, certainly Senator Parkinson and Senator Thomas Fisher. The first item on the agenda is Bill number 162-37 LS. Before I hear from those that have signed up to testify on the bill, I would like to invite the prime sponsor, Senator Parkinson, to please introduce the bill.
Thank you, Madam Chair. I'd first like to start by thanking you again for holding this hearing. This issue is something that I've advocated strongly for, and this is also an issue that the people of Guam feel very strongly about. I'd also like to thank Senator Thomas Fisher for co-sponsoring this legislation with me, and for everyone who came out today to testify. It is great to see everyone. So Bill 162-37 LS, at its core, updates the Women's Reproductive Health Act of 2012. One of the main things it does, it takes away the need for in-person counseling for patients seeking medical abortion, better known as the abortion pill. It also removes the 24-hour waiting period before an abortion can be performed or prescribed. Lastly, it removes the requirements that physician must inform the patient of unnecessary information such as the possible sex of the fetus, the anatomical makeup of the fetus, and other information that aims to essentially guilt-trip a patient into not getting an abortion. All of these things that the bill removes are really quite medically unnecessary and impede on a patient's right to safe and efficient health care. There is no reason why a patient needs to wait 24 hours before medication. In fact, waiting actually works against the patient. There is also no need for in-person counseling when the doctors can do it through a virtual medical consultation. I mean, if you can imagine, if a patient with diabetes needed a prescription for insulin, and their telemedicine doctor said, hey, you have to go see someone in person that will explain to you all the effects of this medication, and then wait 24 hours after that before I can prescribe this to you. Doesn't that sound ridiculous? But this is the reality for patients seeking medicated abortion. The fact is that abortion is legal on Guam. The Supreme Court of Guam affirmed this last year when they decided that the 1990 abortion ban is moot. And it is the duty of our government to ensure that patients seeking abortion should be able to do so without any unnecessary interference by the government. Let me be perfectly clear. I am, and always have been, and always will be, an advocate for reproductive rights and women's rights to choose. I believe that every individual has the right to make decisions about their own body, free from government interference or judgment. The fundamental principle of autonomy and self-determination lies at the heart of our democracy and must be protected at all costs. The current abortion laws under the Women's Reproductive Health Act of 2012 are relics of a bygone era. They are out of touch with the realities of modern life and the beliefs of our community. They place unnecessary restrictions and burdens on individuals seeking to exercise their reproductive rights, forcing them into potentially dangerous and desperate situations. It is unconscionable in this day and age we continue to subject our people to such unjust laws. And also, let me be clear about something else. The people of Guam are pro-choice. They understand the complexities and nuances of reproductive health care, and they overwhelmingly support a woman's right to make decisions about her own body. Our community is compassionate, empathetic, and understanding, and it is time for our laws to reflect these values. Again, thank you, Madam Chair, for holding this hearing, and I look forward to the testimony on the floor today. With that, I yield the rest of my time.
Thank you very much, Senator Parkinson. For the record, the committee has requested feedback and testimony on Bill 162-37 from the following: the Department of Public Health and Social Services, the Bureau of Women's Affairs, Famalawan Rights, the Office of the Attorney General, the Guam Medical Association, and the Guam Medical Society. With regards to legal review, a legal review of the bill was requested from Legal Bureau on August 31st, 2023, and a response from the Legal Bureau was received on November 11th, 2023. With that, the fiscal note, the impact request was sent on August 18th, 2023, and BBMR responded on August 24th, 2023, stating that due to absent information of the Department of Public Health and Social Services relative to the cost and implementation of virtual medical consultations, the Bureau was unable to determine an estimated financial impact on the government of Guam. With that, the committee will now receive testimony on the bill, beginning with, and we will start, I will call up the following individuals that signed up to testify. Ms. Shannon O'Connell, Ms. Alisa Perez, Mr. Gregorio Calvo, Dr. Tom Shay, Mr. Larry Kinata, Viola Aagui, Maria Leon Guerrero. Do we have enough seats for everyone? Please come on. Here's 1, 2, 3, 7 seats. With that, we'll begin with you, Ms. Shannon O'Connell. And just a reminder, please, for our listening audience, if you can just speak as close to the microphone as possible. That way our listening audience in YouTube and at home, if they're watching on their televisions, will be able to clearly hear your testimony. So with that, Ms. O'Connell.
Okay. Dear Senator Brown and other senators here, thank you for letting me be here to present my testimony. Not written into my testimony, but I did want to suggest, add real quick verbally, Senator Parkinson only talked about the removal of the ban of abortion in that 1990 law, which is that Bell's Areola Law of 20-134. You forgot to mention that the in-person requirement was reinstated in the Ninth Circuit opinion when the Ninth Circuit Court reinstated that in-person requirement is actually a very necessary law. So, therefore, stopping telemedicine abortion, this is back in August 2023, so it's not that long ago that this occurred. Okay. So they recognize the need for in-person. As I was reading the introduction of the suggested bill to amend the Women's Reproductive Health Information Act of 2012, I am amazed by how contradictory it sounded from the beginning to the end. First, it states that abortion is legal in Guam. I said, wow to that, since normally abortion supporters are usually trying to send a misleading message that abortion is illegal in Guam, therefore creating a state of emergency and anger amongst pro-abortion supporters. So here they are, first thing announcing that abortion is legal in Guam. That's the truth. Abortion is legal in Guam. It has been legal for a long time. Then it says that they need to address the sensitive issue of abortion using words trying to make it seem like they are very caring and worried for the well-being of women. They move on to state that the aim of this bill is to update the legal framework for the availability of safe and accessible abortion services in Guam. So, now I see what they are trying to do. They are trying to mislead the public to think that here on Guam we have old, decrepit laws that need modernizing. Not true in this particular law of the Women's Reproductive Health Information Act of 2012. This law was initially presented to the Guam Legislative Assembly back in 2009. It took almost 3 years to make it legally correct before it was finally passed with proper wording and legal testing. This act was properly vetted 2009, 10, 11, and into 12 through several AGs before it even made the books. So it's a very legal law. Now starts the ongoing paragraphs of misleading statements to make it sound like the Women's Reproductive Health Information Act of 2012 takes away a woman's privacy, personal choice, and proper informed decision, when in fact the Women's Reproductive Health Information Act of 2012 was designed to protect a woman's privacy, protect a woman's personal choice, and ensure that a woman made a proper informed consent. This suggested bill by Senators Fisher and Senator Parkinson intends to take all that away with misleading doublespeak. In fact, at some point, they even used the dreaded and scary words which causes so much anger among people: religious and moral beliefs. Very scary. Let me modernize our senators and let you know that to be pro-life sometimes has nothing to do with religion or moral beliefs. It basically can be all about the science. Before I start with the suggested changes by this Bill 16237, I will read out what the actual beginning of subsection B says before it goes into B1, where you started your law, where the changes start and where the senators want you to only know about. So this is what the actual law says, subsection B. Informed consent requirement. No abortion shall be performed or induced without the voluntary or informed consent of the woman upon whom the abortion is to be performed or induced. Except in the case of medical emergency, consent to an abortion is voluntary and informed if and only if. And then we start where you start off. This is a clear and direct statement about what the Women's Reproductive Health Information Act of 2012 is all about. For some reason, the senators did not include this portion of the law into their Bill 16237. Voluntary and informed consent being utmost important was what the actual original law was about. So now we can look at what the senators are asking to update by removing requirements of this law. B1, they want to remove the 24-hour period before an abortion and also include to legalize virtual medical consultation. B1, C, and D, they think you don't need to know how far along you are with your pregnancy or what your baby may look like at this stage of your pregnancy. B2, A, B, C, D, E, F. All these sections remove 1, the right for the woman to know that medical assistance benefits are available for her should she continue with her pregnancy? 2, what type of assistance is available for her support after she delivers, or should she decide to give her baby up for adoption? 3, it removes the description of her child. 4, and also removes the information that lets her know what the responsibility of the father is in all of her pregnancy, should she wish to have the father involved at all. It gives her that option to involve him or not, especially in cases of rape or incest. It also removes her right to withdraw her consent to the abortion at any time without affecting her right to future care or treatment, and without the loss of any locally or federally funded benefits, should she change her mind. So tell me how all of the above information that is given to a woman considering an abortion is bad information. How is any of that bad information? Tell me how a woman considering to terminate her pregnancy because of financial problems or economic problems or boyfriend or husband problems does not need to know all of the above helpful information. The above information that they are trying to remove even lets the woman know how she can give her baby up for adoption if she wanted to. Why should we want to tell a person considering an abortion, a life-changing event, that she is not alone? There are so many people and places that can help her. Why wouldn't we want to help her? Subsection B3 wants to remove the requirement that the doctor has to provide the proper printed materials described above, since the senators feel the woman doesn't need to hear, see, or know anything else except let's do this abortion now. Your psychological problems later, after you realize what happened, are not the doctor's problems now. They are yours for life. In the next changes suggested for removal, B4, they want to remove the wording, quote, and in a private room, unquote, which, when the original law was written, it was intended to ensure that the woman's identity and confidentiality was protected by making sure that she was in a private room. The writers of this suggested amended legislation are so blinded by their desire to please the off-island abortion providers that they don't realize they are actually jeopardizing women's health and privacy and confidentiality here on Guam. Now we come to more questionable removals. The rest of the suggested legislation wishes to not amend, but to remove basically all of the rest of the law. Should that happen, it removes all accountability of the doctor. Very questionable move. Section B, 5, 6, and 7. The doctor does not have to report that an abortion was done. It's a free-for-all, no accountability. The doctor does not have to turn in any documentation as to what occurred. Is this called modernizing by going backwards and hiding the fact that an abortion occurred? This opens up a whole new market that existed prior to mandatory reporting of abortion. Victims of rape, incest, or sex trafficking can find a doctor who does these unreported abortions, knowing that these crimes are hidden. Are we going back to that time? Is that what we want? Is everyone here too young, naive, or not informed that these things were happening? And possibly still happening because there are still unreported abortions going on. The rest of the sections being removed also remove any liability to the doctor. It removes the requirement that the doctor must make sure the woman receives information in the language she speaks so that she can completely understand what is happening. Should anything go wrong, the doctor is not held accountable. How are we progressing here? Who is important, the patient or the doctor? As a pro-life person who wishes to save any baby from being aborted, I cannot believe how these senators do not recognize that this whole law, which they are trying to amend and do away with, has everything to do with protecting the woman and her rights now and in the future. The entire amendments have everything to do with pleasing abortion doctors here and off island. It's all about the doctors and nothing about the woman. Let me remind you why this Bill 162-37, which came out on August 8, 2023, was presented. Back on August 1st, 2023, the United States Court of Appeals of the Ninth Circuit issued an opinion which stated that the Women's Reproductive Health Information Act of 2012 was legal and necessary. The opinion number 21-16559, DC number 121 CV 00009, which I will simply state as opinion in further discussion, was issued in regards to the in-person requirement and the Women's Reproductive Health Information Act of 2012. Now, I am going to state right now that I am going to quote or summarize some of the wording of the actual opinion. Since I don't want to be called out as using my own words, I am attaching to the testimony some pages of the opinion so that the reader can see where I got the quote or the summarized part from. I've attached 10 pages from the opinion. In the opinion, it stated that Guam's in-person requirement, commonly known as the Women's Reproductive Health Information Act of 2012, does not violate the due process because, one, it furthers Guam's legitimate governmental interest in preservation of potential life. Two, protection of maternal health. And three, promotion of the integrity of the medical profession. Even they recognize what the wealth of that law is about. The Ninth Circuit also stated that unlike other medical procedures, abortion implicates fetal life in addition to the patient's health, and the in-person requirement bears a reasonable relationship to the legitimate governmental interest of safeguarding fetal life. Also noted was that an in-person consultation can underscore the medical and moral gravity of an abortion and encourage a robust exchange of information. A telephonic or video meeting may be a poor substitute for an in-person meeting, whether it be in the classroom, courtroom, or clinic. The Ninth Circuit Court also pointed out that it was acknowledged that there are doctors on Guam who are willing to do pre- and post-abortion care, but are not willing to put their name out there. Hence the reason for removing the requirements to report the abortions, secret abortions. That's called progress and modernization. The Ninth Circuit Court opinion states that these doctors don't want their names associated with abortions. So they have found a means to hide their identities. They have found friends in the legislature to help them hide who they are. Senators, who are you looking out for? Don't pretend you are looking out for the woman or the child. It's all about the doctors and the cause. Please, Senators, do not pass this suggested legislation bill 162-37. And thank you so much for listening.
Thank you very much, Ms. O'Malley, and I certainly like to recognize Senator Terlaje, who's joined us this afternoon. As a courtesy, I know everyone's testimony here is very important, but we do have some medical practitioners that are here that I know need to get back to their patients. So if I could ask your indulgence, if we can allow them to provide their testimony, if you have no objection to that, and then we certainly will make all the time for everyone else to testify. I will ask Dr. Tom Shay, who signed up first, if he can provide his testimony, and also Mrs. Maria Leon Guerrero to provide her testimony. Is there any other medical practitioner here? Okay, if not, Dr. Oh, okay.
Yeah,
with
could I
that,
get
Dr.
my
Thomas
slides
Shay,
up, please? Yeah, thank you, Senator
we'll
Brown.
recognize you.
Senator Parkinson, Senator Fisher, and Senator Tello was here. I'm here by invitation, and I wanted to be here to be able to answer questions and also speak on the bill, which I've reviewed recently. I also asked for the law that the current Bill 162 is trying to repeal and update. A few things that I noticed that I would like to point out. And to the left would be the Bill 162, to the right is the current law. I think the important thing to look at this entire process is that we want accessibility for abortion, but more importantly, I think the safety factor, that we want to have a safe abortion. But this bill, to me, doesn't make abortion, to me, safer, but it makes access faster, that's for sure, but it's sort of like a drive-through abortion service, and I can explain that a little further. Next slide. This particular slide I highlighted, the bill seeks to minimize, the intent is to minimize the mortality rate and complication associated with illegal or unsafe abortion practices. I don't see, over the last 27 plus years of my practice in women's health on Guam as an OBGYN, I don't see any evidential data that says Guam has an unsafe or increased mortality for women from unsafe practices in the abortion arena. I have not seen one single case of mortality from an unsafe abortion by an OBGYN on Guam. So the intent, also 19 to 20, also states that it want to ensure comprehensive sex education, contraceptive methods, empowering the individual to make informed decisions. But this proposal is doing quite the opposite by deleting majority of the educational content for women and making it a real informed decision regarding abortions. Abortion is unlike any other procedure. We usually do procedures to save the life, of a human being, but be as it may, abortion is different from this. And you can argue the fact about if you don't do the abortion, the mom may die. But for the 27 plus years in my practice on Guam, I've delivered thousands of moms, seen thousands of patients, but I've never seen one case where I had to do an abortion to save the life of the mom. And I've delivered close to 16,000 babies in my career. Now, next slide. This particular slide here in the proposed bill first deletes the 24-hour requirement before an abortion on page 20 of page 3 and added a virtual medical consultation. Now, the 24-hour period goes by super fast. I don't see that as a deterrence for someone getting an abortion. And in fact, I think the 24-hour is a little short, actually, for any procedure that ultimately have its complications. 24 hours is in place to ensure an elective. Most of the abortions, we all know is elective abortions. Provides the patient the time for her to digest that information for her to make the right decision. As a lay person, to expect one to digest everything without the time to understand the process is probably doing the woman an injustice. There's no harm in waiting 24 hours, but great benefits to ensure the patient understands the entire procedure. Second, page 4, you have deleted C, the probable gestational age of the fetus. At the time of the abortion is to be performed, if you delete that, I would think that would be unsafe. And I can explain to you a little bit more. To base the gestational age by the assumption of a last menstrual period can be very unreliable. Majority of the patients I've seen here is thousands over the last 27 years. The last menstrual period varies, especially if you have many patients on Guam with polycystic ovary syndromes. Their irregular periods are there. And I will tell you, many women on Guam are not reliable if you're going to base it on the last menstrual period. This is why, to ensure the proper abortion procedure, especially if you are using the abortion pill, which works up to 10 weeks of pregnancy, under 11 weeks, you must have a reliable gestational age. And there's no harm in confirming this age to ensure safety for the patient. We're not saying don't do it, but we're saying, let's make sure. And that's why the 24-hour plus the ultrasound for gestational dating is important. In addition, for the safety purpose, in order to diagnose an ectopic pregnancy on the island is actually quite high. So if you really want to ensure gestational pregnancy inside the uterus and not outside of the woman, as in an ectopic pregnancy, we want to make sure that you get an ultrasound done at the appropriate time. And this condition can be life-threatening if you don't detect it early. If you can detect the ectopic pregnancy early, you can save your reproductive organs, rather than risk not detecting it early and could be life-threatening. In addition, a condition called molar pregnancy, gestational trophoblastic disease, must be detected early and managed. Without the proper ultrasound done early, and you attempt an abortion with the abortion pill, and if the patient has a molar pregnancy or an ectopic pregnancy, it does not work. What it does is it delays its diagnosis. And once that's delayed, you may lose the opportunity to use medication to save the ectopic pregnancy from the woman harming his reproductive organs. You have to resort to surgical techniques instead. So I think important to realize, next slide, that this is just a quick ultrasound showing you of an abnormal pregnancy that's a molar in appearance. Now, if you don't use an ultrasound to make sure that it's not a molar pregnancy or not possibility of an empty uterus, it could be an ectopic pregnancy, you're going to miss these. One can argue with you that, well, let's just give the pill based on the last menstrual period. If the abortion pill doesn't work, so be it. But then you lose the follow-up of that patient, and the patient goes thinking that she's already gotten an abortion pill, that it should work. Without the knowledge, knowing that there could be an ectopic or could be a molar pregnancy, then you place that woman's life at risk. Now, I won't spend the entire time talking about gestational trophoblastic disease, but it is real and it occurs here on Guam. Next slide. Molar pregnancy occurs on Guam, Asia Pacific, probably about 5 in 1,000 births. So annually, we get about 15 molar pregnancies. Some are cancerous, and some are incomplete, and some are complete moles. These requires close management, and abortion bills, I'm telling you, just does not work in these cases. This is why an ultrasound is important. And be as it may that some may argue the ultrasound is going to deter the woman from having an abortion, I personally don't think so. I think the decision to abort is up to the patient themselves. I'm not there to decide for them or try to convince them otherwise. I use my ultrasound machines to ensure that I can detect early ectopic pregnancy, early molar pregnancies, and abnormalities in the first trimester. We're able to detect anatomical abnormalities in the first trimester now. And with that, if we detect the abnormality, we are able to do genetic testing. And that genetic testing can benefit the patient with future pregnancies. Next slide. Furthermore, the 24-hour period also has a purpose for laboratory examination. It is important for us to realize that all of us have different blood types, but it is more important to recognize that if you're pregnant, you need to make sure that you have an Rh negative or Rh positive, because that has a detrimental effect on the woman's next pregnancy. So without knowing the blood type factor of the mom, we potentially miss an Rh incompatibility. The Rh disease is a condition where antibodies in a pregnant mom's blood destroys her baby's blood cells. So if the mom's blood Rh is negative, she needs to get RhoGAM. Even if she undergoes an abortion and not give birth, she's going to need that RhoGAM. Of course, if the father of the baby is Rh negative, then mom doesn't need the RhoGAM. Now, how long does it take to get the blood test done? I would think at least if you run a stat, 24 hours, 12 hours at the very quickest, but usually, you don't sit there and wait for it. You want to make sure that you give it time. And if you do the blood test on a weekend, you probably get it back on Monday at the fastest. And it's also a good thing to know the CBC level for your patients as well, because we have a lot of anemia on Guam. Especially with the Micronesians, we have a lot of the thalassemias, which is a blood-borne anemia disease that we have to watch out, because when you take the pill, you could lose a great amount of blood. So you want to make sure the safety factor is there. So I think the 24 hours is actually pretty quick. If I had a choice, I go 48 or 72. But, I think what we need to understand is that ROGAM shot, the shot that we give to the pregnant moms, if they're Rh negative, is not readily available on Guam either. I have a patient who's Rh negative, and we have to make sure that they get the ROGAM shot around 28 weeks of pregnancy. We call around, and it's not in the pharmacies. You have to pre-order them. And luckily, GMH has about 10 doses left at the hospital. But, before you do an abortion, you got to make sure that all these things are lined up for the safety of the mother. You don't just do an abortion without knowing the Rh factor, without knowing within 72 hours there has to be ROGAM on island to be given to be effective. If not, the mom can develop antibodies and attacks the future baby of her pregnancy. And that's devastating. And Rh incompatibility affects about 15% of all pregnancies. Next slide. This is just a sort of a visual presentation of what Rh disease look like. And I won't go into big details, but again, if the mom blood type is Rh negative, you got to give ROGAM. And not every provider can remember that. I have instances where the ER doctor, sends me a patient 2 days later, and luckily it's 2 days, 48 hours, and I said, what's her blood type? Oh, we didn't do that. We didn't do the blood type. Well, you got to know the blood type, because if you don't do the blood type, how are we going to know if it's Rh negative or Rh positive? You will be malpractice if you forget to give the mom ROGAM. I will tell you that right now, in today's day and age. So I think the minimum of 24 hours is not a bad 24 hours. I think it gives time for us providers to make sure that all the laboratory data is there. Now, we cannot assume, again, all providers have this knowledge. As OBGYNs, we do, because we deal with this day in and day out. Again, we want safe abortions in a safe environment, and I don't think 24 hours is going to hinder that patient from changing her mind. Now, next slide. This is just a slide of what an ectopic pregnancy is. Many in this audience may not know what it is. An ectopic pregnancy is a pregnancy that's not inside the uterus, inside the woman's womb. The abortion pill will not work for an ectopic pregnancy. If you don't pick this up early, it can rupture, patient can bleed out, and is life-threatening. So I think early detection is important. Ectopic pregnancy occurs between 1 to 2 per 100 pregnancies on Guam, which is quite high. We get about 30, 35 ectopic pregnancies per year. Next slide. Now, on page 5, on page 5 of your proposed bill, it proposes to delete a lot of these patient educational contents regarding public assistance. I don't see a harm to providing the public assistance if the information is going to help the patient. I don't see that as a hindrance or preventing the patient from having an abortion. Next page, next slide. On this particular slide, this section here, remove educational material, and I've heard arguments regarding the difficulty of printing now. If it's difficult to print, you can go digital, but one thing that caught my particular attention is line 4 and 5, which the proposal elected to delete, which is the section that reads, basically, why would you not allow the patient to withhold or withdraw her consent to the abortion at any time? Why would you delete that? I have no idea. A patient, if you respect their autonomy, should be able to cancel or withdraw their consent even at the last moment. So I don't understand why that's deleted, because the consent can be withdrawn, should be able to withdraw at any time. And information should be provided, even if it's telemedicine, it should provide in a language that the patient understands. Now, we also argue about abortion access, and the fear is that the underprivileged, the Micronesian may not have access to abortions, etc. And many of them probably don't even know how to use the internet often. and let alone trying to do telehealth and trying to understand someone trying to explain to them over a monitor or through their phone. So that's something that's going to have to be culturally sensitive. Now, next slide. This section deletes the private room, and I don't think that's bad. Even if you do telemedicine, you can do it in a private room. So I don't know why that's deleted. And I think the private room is put in there is because Guam is so small, abortion is such a sensitive issue. We don't want you to be doing a consult in a mall or outside of a public arena, let alone in a waiting area or in an emergency room where it's in curtains. So I think it's important to ensure privacy, and we want that. We want privacy. Next slide. Again, these are just deletions, and I think financial resources presented to the patient is not a bad idea if one of the reasons is because of financial resources that's preventing them and choosing an abortion. Page 12, next slide. And I'm going through this to kind of help you going through this and just giving you my opinion. Page 12, in case of emergencies, I think this section here is to protect the patient. By removing this section, you actually don't really provide the patient much of a protection, because if a doctor or the abortionist is going to tell a patient that I have to do your abortion right now because if I don't do it, you're going to die. If I don't do it, you're going to have bodily harm. If you don't ensure proper documentation of this, just based on the provider's opinion, then you're not really protecting the patient in this section here. Next slide. Again, this last section here actually also protects the patient of the wrongful diagnosis. So if you really are out there trying to provide safety for patients and protecting the patient from making a wrong decision or a wrongful diagnosis by the doctor, that section actually protects the patient. Next slide. Now, the purpose I think we all want is to keep abortion safe. And I had a dinner last night with one of my OBGYN colleagues, and we discussed this proposed bill, 16237, and we all came to the same conclusion. And our conclusion is that we do want to allow access to abortion, but do it safely. Telemedicine on Guam is not, to me, a way to go. But this bill, with all these deletions, appear to making access to abortions more unsafe, in my opinion. And we had discussed some safety points, but I would encourage you, don't just focus on access, expediency. Don't allow the patient to try to change their mind or thinking that these are a hindrance to preventing the patient from having an abortion. I don't think it is. I think it's providing more education to making a better informed decision. Next slide. Now, when we talk about evidence-based studies, this is one of the more recent studies that I know of from my colleagues, not just in Hawaii, but also in the East Coast. And it's a cohort study, which is an observational study that they retroactively reviewed. Next slide. Of the 3,700 or so medical chart reviews, about 954. You have to really read the study. A study may say it's safe, but you have to read the numbers and read in between the line. 954 had no follow-up. 428 patients underwent abortion had no outcome data. So that's about nearly 1,400 patients in this particular study without data or follow-up. So what they did in this particular study is that they used the imputed evidence-based statistics to modify the actual data. But if you really read the outcome of if you subtract the 3,779 eligible medical review, they actually comes down to 2,000 or so candidates. And 125 of them from the study actually needed additional intervention. So out of this study, 75% were actually had follow-up data, but 25% fell out. But it doesn't tell us what happened to the other nearly 1,400 patients that's lost to follow-up. Again, we can't just focus on access. Next slide. Now, telemedicine is, we have advantages and we have disadvantages. For Guam, I'll talk a little bit about that, especially with the abortion procedure. Of the 112 or 116 patients under this study needed additional intervention, which means that the medical abortion didn't work. 88 of them had to have surgical procedures to follow. 37 had more medication than they needed. And 4 had to have treatment for ectopic pregnancies. 9 continued their pregnancies after the treatment. Safety, they say, is safe. But, they cite 8 blood transfusions that they had is still considered safe statistically. 1 had a major surgery. They don't really list down what major surgery it was. And 6 was admitted to the hospital. So we still have a sizable amount of complications. Guam is small. We don't anticipate that many abortions. In fact, I think abortion is declining on Guam. Next slide. Next slide. Now, I'll finish up with this particular slide, and that's about abortion complications. And, I respect the abortionist who is well-trained and, in this field of medicine where they provide abortions. And I know them very well. They're colleagues from off-island. I know them as a group, and they do what they do best. They know how to do their abortions, and they do it well. But on Guam, they're not here to see what we see on Guam. Our patients are here. You can be in a computer screen, but the provider is across the screen on another island. The question is, who is going to manage the complications? There are complications even with abortion pills. Although one may argue that it is rare, but we are about patient safety. Should there be a complication, hemorrhage, bleeding, incomplete abortion, infections, failed abortions, ectopic pregnancies, molar pregnancy, who's going to be here, or who will be the person to manage these complications? So before you pass a bill that allows teleabortion, I think that question needs to be answered very carefully. Guam is unlike Hawaii, unlike other states, where they have thousands of board-certified OBGYNs. Lacking medications, even at the hospital. Sometimes we even lack blood supplies. And you expect a patient who undergo a teleabortion, a provider who is not on Guam, who provides abortion services, they're not here to handle their own complications. To mail out abortion pills by mail, are you sure that that abortion pill is going to get to the right hands once it gets to Guam? But more importantly, again, going back, is the safety net aspect of it. I think it is important to have some clear ideas on ensuring more safety for patients with follow-ups and allow and ensure Guam's women is safely cared for. By that, we have to ensure there is follow-ups, and if there's complications, you have qualified providers who is here to take care of them. And that's the end of my testimony. If you have any questions, I'd be more than happy to answer them.
Thank you very much, Dr. Shay, with that. Maria Leon Guerrero, if you can provide your testimony, and then if our colleagues here have any questions, we'll allow that to happen, or comments, and then we'll let you go and we'll continue on with the panel. Thank you very much.
Okay. Hafaday, members of the 37th Guam Legislature, Senator Brown, Senator Taitagui, Senator Parkinson, and Senator Fisher. My name is Maria Leon Guerrero, and I am the Board Treasurer for the Guam Women's Chamber of Commerce. Thank you for the opportunity to provide testimony on Bill 162-37. The vision of the Guam Women's Chamber of Commerce, or GWCC, is that Guam will be an island community whose economy is driven and influenced by the equal participation of women in business. One of our key objectives is to influence legislative policies on issues facing women in business and the workplace. GWCC recognizes the issue of abortion is controversial for many reasons. GWCC also recognizes that the decision of when and whether to have a child is one of the most important decisions a woman can make. It impacts every other aspect of a woman's life and that of her family, including her ability to participate in the workforce and in the overall economy. We recognize the sensitivity and polarizing nature of this issue. For these reasons, GWCC feels this is a decision that should be made privately. The purpose of Bill 162-37 is to enable healthcare providers to offer essential reproductive healthcare services, including abortion, without unnecessary government interference into the medical provider-patient relationship. The findings and intent of Bill 162-37 state in part that by recognizing the unique cultural and socioeconomic diversity of Guam's population, we must address health disparities that disproportionately affect certain communities in accessing reproductive health care. By updating Guam's abortion laws, Y Legislatura en Guam aims to ensure equal access to reproductive health care services, regardless of economic status, ethnicity, or geographic location. Given our vision of equal participation of women in business and in our economy overall, the Guam Women's Chamber of Commerce supports equal access to reproductive health and all health services. Bill 162-37 would effectively remove barriers to health care in our community, barriers and mandates that only apply to women in Guam. The parameters of the Women's Health Information Act of 2012 targets a singular medical procedure, abortion. Women seeking information related to an abortion are required by law to have in-person counseling. Women are also mandated to comply with other medical and social requirements that are not compulsory for any other medical procedure. Failure to provide certain information to a woman, regardless of whether she or the medical professional deems it appropriate information for her situation, is deemed criminal. Bill 162 would remove these restrictions and barriers that impede a woman's access to health care and interfere with her private personal medical provider-patient relationship. The Women's Health Information Act's in-person counseling requirement disproportionately impacts low-income populations. Abortion services are scarce to non-existent on the island, as others before me have stated. For the vast majority of our population who cannot afford to travel, the only feasible way to access abortion services is through telemedicine. The in-person counseling requirement presents a significant barrier for low-income persons to access the health care they need and could potentially drive them further into poverty. The Guam Women's Chamber of Commerce supports Bill 162-37 as it will promote equal access to reproductive health care services regardless of economic status, ethnicity, or geographic location. Additionally, Bill 162-37 will ensure that those seeking reproductive health care services can do so with respect for the privacy and confidentiality of the medical provider-patient relationship. Si Dios masi.
Thank you very much for your testimony. Colleagues, do you have any questions? Senator Parkinson, do you have any questions or comments for our doctors here before they leave? Senator Tom Fisher.
Yes, thank you very much. I was reading, this is, I guess, an observation to the Guam Women's Chamber of Commerce and your testimony, ma'am. I think you hit the nail on the head as far as the jurisprudence of the abortion discussion goes. I'm sure you're aware, and I kind of wish we had taken her advice. Ruth Bader Ginsburg said that the right to abortion should have been found in the Equal Protection Clause, and I think that's exactly right. That meddling in a woman's right to choose prohibits a woman from fully participating in the economic life of the island and the United States, and I think that's a clear equal protection violation. I'd like to thank the Guam Women's Chamber of Commerce for bringing that very important observation to us. Thank you.
Thank you, Senator.
Thank you very much, Senator Fisher. Senator Terlaje, do you have any questions or comments?
Thank you, Madam Chair. I do apologize for being late, but I was watching the whole thing as I was driving here and listening. And, you know, like you always do, you know, Sharon, you provide your due diligence in studying this. You came forward today in a perspective to ensure the safety and well-being of a woman, period, today. And I thank you for that. The information that you provided is going to be very helpful for some of the senators who are not listening or who are not here today to be able to go over the comments that you made and look at what was previously done and the intent of the original law that's trying to be, you know, repealed today. I think Dr. Shay hit it on the head of the nail when you brought up the safety and well-being of a patient, the importance of it. And it's not just the safety and physical safety of a woman's, you know, care, but it's the mental part that you brought up, Sharon, that really is so important. I mean, most people can go and exercise to try and lose weight, and but if they don't have that mental capacity to move forward, you know, to actually get up and go to the gym, you know, and work out, or, you know, anything that just to get their mind to change, then we're doing a disservice to the patients that you as physicians provide to your patients. And that is not just the physical aspect, but the mental aspect. And I think that's why the original bill was put in place, to cover all angles, to offer, you know, that patient the opportunity. I mean, for us to say, well, let's bypass all that just so that we can push them toward abortion. I mean, that's what this bill basically does, is let's just push them toward abortion. So I greatly appreciate the comments, too, by the Women's Chamber. I mean, 9 women to discuss something like that is very minimal. I wish it was a lot larger. I know you have more than 9 people in the Guam Women's Chamber, so that would have been very helpful to hear their concerns too as well. It wouldn't have been an 88% versus 11% scenario. I'm pretty sure 9 is not a very good number, you know. But I think Dr. Shay, again, providing your professional opinion and being on this island for so long and how many babies that you've delivered, and I think we should, you know, take great heed to listen to what you had to say today. And I appreciate it again for those who came and testified. So thank you, Madam Chair.
Thank you very much, Senator Terlaje, and thank you also to Ms. O'Malley, Dr. Shay, and also Dr. Maria Leon Guerrero. Thank you very much for coming in and providing your comments.
Yeah, Senator Brown, I forgot. I think Senator Terlaje had brought a good point. I didn't mention the emotional aspect of it, the waiting period, etc. I have not come across women who have decided not to go through an abortion and had the regrets. But I have come across some women that had an abortion and had regrets. So I think, to Senator Terlaje's point, I think that is a very good point that she brought up. Not just the physical scars, but the emotional scars can last even a lifetime. Thank you.
Thank you. Thank you very much, Dr. Shay. Shannon, Ms. O'Malley, you have something you want to comment on as well?
Yes, Ms. Senator Terlaje and Dr. Shay said something, and I wanted to bring it up. When I became more involved in the pro-life movement, I started meeting a lot of variety of women. I've met so many women who almost had an abortion, and they're so grateful it didn't happen. I mean, they're still crying when they're telling me, and these ladies are older, they're telling me what almost happened, and they're still crying, and they just can't get over how traumatic the decision was for them to do it or not to do, and how traumatic it was, and Many years later, so grateful it did not happen, but I mean, it was a traumatic time, and I try and put myself in there. Then we have this program, and I've met many women who have had abortions, and we started this program here on Guam under it's called the Rachel's Vineyard Retreats, and what it is, it offers post-abortive care. And so I have met women in their 50s, 60s, and then young ones too, who the effect of their abortion is long-lasting. It hits them way after, and it's truly traumatic. And so we see the damage of an abortion, and we're not condemning them or judging them. We're just simply there to help them, because these things do happen. Thank you for bringing up the emotional part of it. And this is why I really think it's very important that a woman be informed, properly informed, and 24 hours is not enough time, and I agree. I Googled, when I was just given a new medicine, I Googled it, and I wouldn't take the medicine for at least 3 days until I after read every part of it under every research, called up a couple doctors about this certain medicine. I was listening to what he was saying in 24 hours. No, it took me 3 days to decide to take that medicine. I mean, and I didn't want it. That's what I'm saying. It takes time. Everything takes time. Sorry, thank you.
Thank you very much, Ms. O'Malley. With that, we'll continue our testimony for those that have signed up. Ms. Alisa Perez. Thank you. Welcome.
Good afternoon, Senators. My name is Alisa Perez, and I write this testimony opposing Bill number 162-37. The amendment of Section 2, subsection B1, Section 3218 of Title 10, Chapter 3, Article 2 of the Guam Code Annotated removes the 24-hour period in which important information is provided to the pregnant woman who is performing the abortion method, and the immediate long-term medical risks. The removal of the 24-hour period before the abortion does not allow the pregnant woman time to process what it is she will be going through. She walks into the clinic or hospital scared and confused, and there she is bombarded with all this information and does not have time to make a rational decision. The amendment also removes the gestational age of the unborn and the probable anatomical and physiological characteristics. The intent of its removal is to take away the humanness of the baby. This takes away the opportunity for the pregnant woman to see and understand that this is a human being, a baby she is carrying. Subsection B2 removes all the opportunities that would help a woman understand and be informed of the availability of medical assistance, public services to help with adoption, printed materials describing the unborn child, information on child support, and information that the pregnant woman is free to withhold or withdraw her consent to the abortion at any time and without affecting her right to future care or treatment, and without the loss of any locally or federally funded benefits to which she might otherwise be entitled. Subsection B3 removes the requirement of printed material by a qualified person at least 24 hours before the abortion. It removes the requirement of having material read to the woman if she cannot read, and it also removes the requirement of providing answers to the woman in a language she can understand if she has questions concerning the information or materials provided. Subsections B5, B6, B7, and B8 removes the requirement of informed consent. Reporting the number of certified consents for abortions to the records section and making such numbers available to the public annually. Subsections C, D, E, F, and G removes the requirement for printed material to be available to pregnant women that would inform them about organizations that assist women through pregnancy, about child support, and other information to help a pregnant woman make an informed decision, and that there are other options other than abortion. This bill repeals all the language that allows a 24-hour time frame to think and process this very life-altering decision on both the mother and the child. It repeals all the language on the vital information of what other options are available other than abortion. It repeals all the language on informed consent. The jargon of reproductive health, freedom of choice, makes one think that this bill is helping a pregnant woman make a choice, when in fact it takes away the woman's freedom of making an informed choice. It's as if the only choice is abortion. Senators, please look deep into your conscience. Read and reread this bill. Is it being fair? Whose interests are you looking out for? It appears it is not that of the mother, and definitely not that of the smallest innocent person, the baby. Please, Senators, do not pass this suggested legislation, Bill 162-37. Thank you for your time.
Thank you very much, Mrs. Perez. With that, we'll have Mr. Gregorio Calvo provide his testimony next.
Buenas and Huffaday, Vice Chairperson Joanne Brown, Senators Telaje, Senator Parkinson, Senator Fisher, the Committee on Health, Land, Justice, and Culture. I'm here to testify before this committee on Bill 162-7 LS. In my humble observations over the years, it seems to this day, it seems that there's a continuing need to remind all of us that demonic activities, darkness continues to permeate our island. Paraphrasing from National Intercessor Dutch Sheets, he says, we're in a battle for truth and integrity as never before. A fact of the creation of man from the Bible, the Holy Word of God. The Lord God is the creator of heaven and earth, and in Genesis 1:26-28, God said, let us make man in our image. So first and foremost is to call out that in Bill 162-37 LS Section 1, the legislative findings and intent in which the legislature in Guam finds that abortion on Guam is legal, and that is the duty to recognize our responsibility to uphold rights and well-being of the people of Guam. I respectfully submit to you that we're still in the aftermath of the Supreme Court of the United States Dobbs versus Jackson Women's Health Organization decision of 2022, and that there's still the legal follow-through that is needed and is being done at this moment. And so what we are looking for is for island leaders to do what is right and just before an almighty God in whom government is placed upon his shoulder. See, government is not on your shoulders alone. It is based on what is God-given. So let's not be deceived about the difference between good and evil. Dot Sheets, a national intercessor, in his column gave him 15, February 6. He says, in America we have an ungodly government, educational system, and media. This great erosion of the family unit, gross immorality, a loss of purpose as a nation, lukewarm church, and we could go on and on. So my basic assumption in appearing before you today is based on the Bible in the book of Proverbs, chapter 14 and verse 27. The fear of God is the fountain of life, and that one may turn away from the snares of death. That's the only way we can find out what is the truth. Let's go to the source of truth. So instead of doing what is humanly possible to clarify that there's a void left in the wake of the Supreme Court ruling, Dobbs versus Jackson, of a year ago, and in the laziness of a former former Attorney General, combined with the mindset of this administration against sanctity of life, the attempts of our own Supreme Court of Guam to confuse the situation. Therefore, the culture of death continues to dominate over the island of Guam. Where is the public outcry against so horrendous a predicament that we are placed in? Thank God for the initiative of the current Attorney General to file for the clarification of a status further up in the judiciary ladder, and thank God for at least a number of you senators that continue to have a clean fear of God. So there's, for over 6,000 years, mankind has acknowledged, recognized, and was given the cognitive initiative of a conscience, that man was created by the Creator. Now, of course, we've had dissension over all of history, There have been some that have generated their own worldviews. But the general concept that we were created is there. And then, surprise, surprise, 1973, 7 of the 9 justices of the U.S. Supreme Court made personal decisions and proceeded to negate the essence of the sanctity of life over the United States of America. This was promptly followed by the rest of the nations around the globe. 45 years later, 50 years later, that decision has been negated themselves. But what a price. The medical profession over all of history and in every country have acknowledged that the creation of a baby in the womb is upon conception. I mean, what's so hard about that? The Heritage Foundation says in 6 weeks, the baby has a heartbeat. In 12 weeks, the baby can wiggle his or her toes, her fingers, his fingers. In 15 weeks, the baby can feel pain. In 21 weeks, the baby, in wiggling his or her toes, can start kicking. And I've been there when I've seen babies in the womb kicking at the sound of their name. And at 24 weeks, it's actually viable outside the womb. I'll never forget speaking to a lot of young people who tell me, you know, Mr. Calvo, the reason why I have an inferiority complex is because I was a premature baby. I said, so what? You were born, and look at you now. Don't worry about that. The fact that the Declaration of Independence states that all are created equal, that they're endowed by their creator, with not the government of Guam, with certain unalienable rights, that among them are life, liberty, and the pursuit of happiness. Isn't it something that the Constitution of the United States follows this precept? This includes babies in their mother's womb. And then there's the fact that there's been more than 63 million babies aborted, silenced, and I say murdered in the United States of America since 1973, the Roe v. Wade Supreme Court decision. And on our great and wonderful island of Guam, this is really something. I am so shameful. The stench of 33,000 babies aborted. And I know some of their parents. And I'll tell you right now, many mothers regret. This is like a curse on our legacy. It's much like the declaration of the Spanish that Guam is called Isla de Ladrones. And this curse passes on down. And so my wife Irene and I want to say this as in the case I'm going to be cut off, like I was cut off in the last time. My wife and I have been blessed with testimonies that there have been at least 17 boys and girls. Now, I don't know how we got this count in reality, but they came up to us, or their parents told us that because we spoke to them, that they were able to continue the existence of their baby. And look at this child now. Intercessors for America, I found this in April 26 in their writings, wrote, Exposing the Roots of Abortion in America. This article recorded that a small town of Athens, Texas, was where abortion experiments began many years ago. Yet today, the state of Texas stands as having the highest level of pro-life public law. They were the ones who initiated the Heartbeat Act. So you see, we can reverse history and past curses. So from the Word of God, the Bible, what is truth about abortion? Fact, over 3,400 years ago, Moses made public the 10 Commandments as the Almighty God gave him as the tables of the law on Mount Sinai, Israel, declaring that one of them was, thou shalt not kill. That's the 6th commandment. And in case it misses some of us, it also means a baby in the womb. They count too. And then from the Family Research Council in Washington, D.C., from their biblical principles for pro-life engagement, it states that when human life is present, there is a person with moral standing deserving of legal protection. This Bill 162-37 LS is much like the way the 7 Supreme Court justices in 1973, in making a decision to designate Roe v. Wade, law of the land, and then were made null and void the legislative process that the Constitution reserved exclusively for the legislative branch. And now, 50 years later, we now realize that there was a mistake. Fact, it is known that the Democratic majorities in the U.S. Congress in every year since 2010 have advocated, pursued the introduction, passage of legislation legalizing all avenues to allow abortion, even abortion on demand, as well as in the federal funding of abortions by the number one provider of this hideous acts against our American society by the infamous Planned Parenthood organization. So we can understand it is very difficult for our local Democratic senators to change their views on the issue because it's passed on down. You're part of the Democratic Party of the United States, well, you have the responsibility. And I might add, the Republican Party has the same problems. 6 years ago, we could count on at least 3 Democrat pro-life senators. I don't know what happened 2 years ago with the veto by the governor of the Guam Heartbeat Act and no override. I don't know what happened. Thank God for most of the Republican majority who at least have a clean fear on the sanctity of life. From the Family Research Council, how to change your pro-choice friend's heart? Well, when faced with the question of wouldn't a child be better off aborted than living in an abusive environment? Well, acknowledge these possibilities, proceed to address these areas one at a time, and conclude with this premise, that pertaining to a child in the womb, there is no other problem that we can resolve by killing an innocent child. Fact, recently Human Coalition circulated a petition stating millions of Americans believe life in all stages as precious and that attack on the preborn is an attack on everyone's freedom. The blatant disregard for life in our country is not only abhorrent, but stands in stark contrast to the values our country was founded on. I signed that petition. Fact, the late Supreme Court Justice Scalia said over the 45 years of Roe v. Wade, and this is just before his death, he says, where is the public outcry? Well, today, I pray that this is the beginning of the public outcry, that this island of Guam will truly know what is the truth, that the truth would set you free, and that our stand today is only the beginning. We promise all of you who are in office today that we will continue to promote the truth. From livenews.com, 50 other states and territories, I've got the materials here, shows all the different things that are happening across the states. 24 states today are now known as pro-life states. Only 15 are really in reality pushing abortion. There's a lot of them still in the in between. From Washington, D.C., just a year ago, the Mayor Muriel Bowser refused to investigate the gruesome late-term abortions discovered in the district of abortions that were committed of almost full-term babies. What are they hiding? The National March for Men's March to Abolish Abortion is scheduled for 3 weeks from now, March 2nd in Temecula, California, said this in their flyer. There is a man connected to every abortion. And this is why I don't understand why we don't hear about men in the abortion issue. That men are a big part of the problem. It's one half of the problem. It's time for men to become a big part of the solution and for all people of goodwill to stand for the full protection of the preborn without exception. I'm getting close to finish. From Live Action Organization, it seems that the abortion has been allowed to grow because of the silence of people who get intimidated, who don't want to tell others what to do, or who don't want to offend. Being loving and respectful is always good. Yes, it's good. But remaining silent, I will not be silent anymore. Because we are afraid to offend can actually encourage abortion. And everybody within the sound of my voice, I speak the truth. That at least what I'm saying, if it's going to save one life, then I'm saying it right now. Then in the book of Romans 13:1, these are the highest authority in my life, the Word of God. God established government and delegates this authority to mankind to accomplish His will on earth. And one day there's going to be an accountability. And I don't mean elections. In Matthew 6:10, godly government should reflect kingdom values. Where is it that abortion, the killing of babies in their mother's womb, is one of God's kingdom values. That's why those of you that have any religious background, you better check where is it that is the truth? The truth that combines us all is that if we fear God, then we know there's a creator. Let me close. There's one more thing I forgot that of necessity I must bring up. Ideas have consequences. Ideas have consequences. When abortions began in America, it was in the state of New York. 50 years later, in 2020, COVID-19 pandemic appeared first in New York State, and at its peak, New York State had the highest cases of this pandemic among all the 50 states and 5 territories. And as a contrast, current Justice Amy Coney Barrett was born in 1970, about the time of the start of the abortion era, and was appointed 50 years later to the United States Supreme Court, and it was her vote that strengthened the majority opinion that ruled Roe v. Wade null and void in the Dobbs v. Jackson decision in June of 2022. It seems that God is not mocked. In 2 Chronicles 7:14, if my people who are called by my name humble themselves and pray and seek my face and turn from their wicked ways, then I will hear from heaven and will forgive their sin and will heal their land. In closing, right here in the island of Guam, I thank God for the Catholic Pro-Life Committee. Thank you all for standing all this time, for their faithfulness in promoting the culture of life. The culture on Guam is a culture of life, not a culture of death. But I'm sad to say that there's no such movement within the 70 Protestant churches. Therefore, in an encouragement to all the priests and pastors, I plead with you to stand up for the sanctity of life in this public forum. Keep preaching what is important, that God is the creator. He's the creator of life, that He gave a commandment that we will not kill, which includes babies in their mother's womb, and that life begins upon conception. The people of Guam need instructions so we can make right and just decisions. Seduce mercy. May God have mercy upon all of us, people of Guam. Thank you.
Thank you very much, Mr. Calvo, for providing your testimony. Next, we'll have Mr. Larry Kinata.
Thank you, Senator Brown, Parkinson, and Fisher, and Terlaje. What I have in front of me is Father's love letter, okay? I'm just going to read it, then we'll talk at the end about my intention of why I'm here. So this letter starts by saying, "My child, you may not know me, but I know everything about you." Psalm 139, verse 1. "I know when you sit down and when you rise up." Psalm 139, verse 2. "I am familiar with all your ways." Psalm 139, verse 3. "Even the very hairs on your head are numbered." Matthew 10, 29 to 31. "For you were made in my image." Genesis 1, 27. "In me you live and move and have your being." Acts 17, 28. "For you are my offspring." Acts 17, verse 28. "I knew you even before you were conceived." Jeremiah chapter 1, verse 4 and 5. "I chose you when I planned creation." Ephesians chapter 1, verses 11 and 12. "You were not a mistake, for all your days are written in my book." Psalm 139, verses 15 and 16. "I determined the exact time of your birth, where you would live." Acts 17, 26. "You are fearfully and wonderfully made." Psalm 139, verse 14. "I knit you in your mother's womb." Psalm 139, verse 13. "And brought you forth on the day you were born." Psalm 71, verse 6. I have been misrepresented by those who don't know me. John 8, verses 41 to 44. I am not distant and angry, but am the complete expression of love. 1 John 4:16. And it is my desire to lavish my love on you. 1 John 3:1. Simply because you are my child and I am your Father. 1 John 3:1. I offer you more than your earthly father ever could. Matthew 7, verse 11. For I am the perfect Father. Matthew 5:48. Every good gift that you receive comes from my hand. James 1:17. For I am the perfect Father. Matthew 5:48. Every good gift that you receive comes from my hand. James 1:17. For I am your provider, and I meet all your needs. Matthew 6:31 to 33. My plan for your future have always been filled with hope. Jeremiah 29:11. Because I love you with an everlasting love. Jeremiah 31, verse 3. My thoughts toward you are countless as the sand on the seashore. Psalm 139:17 and 18. And I rejoice over you with singing. Zephaniah 3:17. I will never stop doing good to you. Jeremiah 32:40. For you are my treasured possession. Exodus 19, verse 5. I desire to establish you with all my heart and all my soul. Jeremiah 32:41. And I want to show you great and marvelous things. Jeremiah 33:3. If you seek me with all your heart, you will find me. Deuteronomy 4:29. Delight in me, and I will give you the desires of your heart. Psalm 37, verse 4. For it is I who gave you those desires. Philippians chapter 2, verse 13. I am able to do more than you would possibly imagine. Ephesians 3:20. For I am your greatest encourager. 2 Thessalonians chapter 2, verses 16 and 17. I am also the Father who comforts you in all your troubles. 2 Corinthians verse 1, 3, and 4. When you are brokenhearted, I am close to you. Psalm 34:18. As a shepherd carries a lamb, I have carried you close to my heart. Isaiah 40, verse 11. One day I will wipe every tear from your eyes. Revelation 21, verses 3 and 4. And I'll take away all the pain you have suffered on this earth. Revelation 21, verses 3 and 4. I am your Father, and I love you even as I love my Son, Jesus. John 17:23. For in Jesus my love for you is revealed. John 17:26. He is the exact representation of my being. Hebrews 1, verse 3. He came to demonstrate that I am for you, not against you. Romans 8:31. And to tell you that I am not counting your sins. 2 Corinthians 5:18 and 19. Jesus died so that you and I could be reconciled. 2 Corinthians 5:18 and 19. His death was the ultimate expression of my love for you. 1 John 4:10. I gave up everything I love that I might gain your love. Romans 8:31 and 32. If you receive the gift of my Son Jesus, you receive me. 1 John 2, verse 23. And nothing will ever separate you from my love again. Romans 8:38 and 39. Come home and I'll throw the biggest party heaven has ever seen. Luke 15 verse 7. I have always been father and will always be father. Ephesians 3:14 and 15. My question is, will you be my child? John 1:12 and 13. I am waiting for you. Luke 15:11 to 32. Love your dad, Almighty God. So we came here in love, okay? Upon conception, that child became a person, okay? As the commandments does not kill, we believe in that. My colleagues believe, two of them sitting with me here believe in that. But it's all about love, okay? If we love that child should never be aborted. In Jeremiah 11:29, God said, I know the plans I have for you to give you a future and a hope and not to hurt you. Let's give that child a chance to live. We have no right to any abortion. We have no right to kill. Because one day we will line up in front of the judgment seat, which will be Jesus, and he's going to ask these questions to us. What happened? How come we killed this child? I said, we should come up with better ways. The government should come up with better ways to let every child on this island be born. The opportunity to what God has planned for this child. I was guilty of an abortion over 30 years ago, and I regret it. By then, I didn't know God. I only know Larry, myself. I don't look to God. But my brothers and sisters, one day we will line up. Then we will see who God really is. Thank you.
Thank you very much, Mr. Kinata. With that, we'll have Viola Aagui to provide your testimony, and then certainly if our colleagues have any questions or comments for this panel, and then we'll be able to proceed from there. Thank you so much.
Thank you, Senator. Oh, men of plenty faith. Oh, men of plenty faith. Yeah, they join us on Wednesdays in front of this building, praying for the end to abortion. My name is Viola Aagui, a resident of Agana Heights. I'm here to oppose Bill 162-37. This bill's intent is to safeguard abortion's legality in Guam. Yes, the killing of the unborn child. How do I know? Every reference to the unborn or born child in the Women's Reproductive Health Act of 2012 is stricken out with one solid black line in Bill 162. Every child, unborn child, stricken out. I'm just going to go through page 4, lines 1, 3, and 16. Page 5, lines 6, 7, 11, 16, and 20. Page 6, lines 1 and 2. Page 9, lines 2, 6, 7, 15, and 16. Page 10, lines 3, 4, 8, 9, 11 to 19. I want to read the 11 to 19. They want to strike this out, and I wonder why. Verbatim, printed materials that inform the pregnant woman of the anatomical and physiological characteristics of the unborn child at 2 weeks gestational increments from fertilization to full term, including color photographs of the developing unborn child at 2 weeks gestational increments. The description shall include information about the brain and heart functions, the presence of external and internal organs during the applicable stage of development. If a photograph is not available, a picture must contain the dimensions of the unborn child and must be anatomically accurate and realistic. The materials shall be objective, non-judgmental, and designed to convey only accurate scientific information about the unborn child at various gestational ages. Wouldn't it be nice if the woman considering abortion knew that, the developing bodily functions? And then lines 13 and page 13, lines 6 and 7. The only time the word child is allowed in print is found on page 4 under section 2, labeled C, and reads, to inform the mother in person or through virtual medical consultation or telemedicine the following: the medical risk associated with carrying the child to term. That's the only time you're going to see the word child, to warn you about, oh, the baby might be a risk to be brought to life, to be born. Senators, we need not be pro-life or pro-abortion to see how this bill denies the mother's full and rightful recipiency of information if found in an unintended pregnancy. It even dishonors her deeply personal and complex choice. The bill's language on page 2, line 18 and 19, as evidenced by the bill's eradication of hopeful and helpful information in the dangerous amending and repealing, updating of whatever you want to call it, of the Women's Reproductive Health Act of 2012. Please consider, too, the stark difference between Bill 12237, Section 1, the introduction, I guess, and Bill 5231, Section 1. 162 has a subjective emotional appeal. 52 is objectively stated. I'm always taught to trust the objective statement. So please no to this bill, and let's keep this island the gem of the Pacific. Right now in the United States, Mrs. Kamala Harris is going state by state, just pushing this reproductive. Come on, women, you've got to make this be an election. You must protect your right to kill a baby. That is the goal, and I hope let's not follow that line. Let's keep this Guam a day of America's Day begin where babies are born. Thank you. Thank you.
Thank you very much, Ms. Aagui. Colleagues, do you have any questions? Do you have any questions or comments, Senator Parkinson?
I don't have any questions, but I do have a testimony I would like to read into the record when it's appropriate, ma'am.
Well, I think if you don't have, we can do it after the panels have testified.
Sure, ma'am. That's
Okay.
fine. That's
All
fine.
right. Thank you very much, Senator Parkinson. Senator Terlaje, do we have any questions or comments?
Thank you, Madam Chair. Just a comment. I just want to thank you for coming here today and testifying, and you made a lot of great comments that make sense, total sense. And I guess the one that's still resonating in my ear is, thou shalt not kill. Thank you.
Thank you very much for all of you in this panel for coming today and providing your testimony for the members of the legislature and our public to hear. If you have any written testimonies that you've not provided, please do so to provide to speaker staff so that we can definitely include your written testimony as well in the record with regards to this bill. The additional individuals that are here that have signed up to testify is Jane Flores, Ms. Stephanie Lorenzo, if you can come forth, Tatiana Rages. I also have a Mr. Don Eani, Ms. Agnes White, and Ms. Patricia Analon. I think we should have enough seats for everyone altogether, yeah. And then I also have Mr. Ray Kinsella. Okay. These are the last listings of individuals that I have in this panel that have signed up to testify. So with that, if we can have Ms. Jane Flores. If you can start by providing your testimony. Thank you.
C-Juice-Masi, Hafaday, Senator Brown and committee members. My name is Jane Flores. I'm the director of the Bureau of Women's Affairs for the administration of Governor Lou Leon Guerrero and Lieutenant Governor Josh Tenorio. C-Juice-Masi for the opportunity to testify in favor of Bill 16237 relative to updating the Women's Reproductive Health Act of 2012. I would first like to commend the bipartisan effort of the bill's authors, Senator Will Parkinson and Senator Tom Fisher, for addressing the issues created by the 2012 legislation. The purpose of Bill 16237 is to allow healthcare providers to provide essential reproductive health care services without unnecessary government interference into the physician-patient relationship. The bill's legislative findings and intent indicates that updating the island's abortion laws is not an endorsement of the procedure itself, but an acknowledgement that it is a deeply personal and complex choice. It is important to note that this bill does not attempt to change Guam's current abortion law, which was enacted in 1978 and provides that an abortion may be performed within 13 weeks after the commencement of a pregnancy or within 26 weeks after the commencement of a pregnancy if a physician has reasonably determined using all available means that a child would be born with a grave physical or mental defect, or that the pregnancy resulted from rape or incest, or at any time after the commencement of the pregnancy if a physician reasonably determines using all available means that there is a substantial risk that continuance of the pregnancy would endanger the life of the mother or would gravely impair the physical or mental health of the mother. Bill number 16237 does not substantively alter existing gestational limitations and exceptions applicable to abortions, but removes unnecessary and prejudicial conditions, notably the restrictive in-person counseling requirement for a person seeking medication abortion, which is not required for any other medical procedures. Since the COVID-19 pandemic, telemedicine counseling has been permitted for nearly all medical procedures. Further, Bill 162 removes requirements that subject individuals to unnecessary medical and social information as a condition to obtaining an abortion, and removes criminal penalties for failure to provide this required information. Reproductive choice is clearly the will of a majority of the people of Guam. As I stated last year when this bill was introduced, the people have collectively signaled their support for reproductive choice twice now through voter mandates. First in 2018 when they elected our first female pro-choice Magahaga, Lourdes Aagui Leon Guerrero, and in 2022 when they soundly re-elected the pro-choice team of Governor Leon Guerrero and Lieutenant Governor Joshua Tenorio. Another sign of the people's support for individual reproductive rights was the overwhelming testimony against Bill 29136, the Guam Heartbeat Act, and its subsequent defeat by failed override in the 36th Guam legislature. Bill number 29136 would have placed severe restrictions on abortion. It is a published, recorded fact that the Committee on Health received 284 written testimonies in favor of that legislation and an overwhelming 881 pieces of testimony against it, a 3-to-1 margin opposing the passage of such restrictive legislation. These statistics were part of the legislative record. It has always been the position of this administration that reproductive health care is a personal decision that should be made by an individual in consultation with their physician and anyone else that the person chooses to engage in that decision, and that abortion should be included as a part of the full range of reproductive health care options available for the people of our island. The Bureau of Women's Affairs is partnering with the Department of Public Health and Social Services to expand access to birth control options for our people in order to prevent unwanted pregnancies, thus greatly reducing the need for abortion. We are also working to expand access to prenatal care on our island to help ensure that women give birth to healthy, thriving babies. Again, Senators, the mandate from the people with regard to the issue of whether abortion should remain a viable, accessible, necessary, and personal reproductive health care option for Guam is clear. Please leave an individual's reproductive choices to that individual. No government, religious organization, or any other entity should be able to impose its will on such a personal medical decision. In fact, there is no other medical decision in which the government has so forcefully tried to intrude. Bill 16237 respects the privacy of reproductive choice and the privacy of the physician-patient relationship. Si Jus Masi for this opportunity to provide testimony in full support of Bill 16237.
Thank you very much, Mrs. Flores. With that, we'll have Stephanie Lorenzo.
Buenas and Hafide, Senators of the 37th Guam Legislature. My name is Stephanie Lorenzo, and I am the Executive Director and co-founder of Familao Rights, a reproductive justice initiative focused on addressing the lack of reproductive health care within Guam's island community. And our organization would like to present testimony in favor of Bill 162. As a pro-choice nonprofit organization dedicated to defending reproductive rights, we stand on the front lines of this fight, and we are here to amplify the voices of those whose rights have been unjustly restricted for far too long. I'd like to speak a bit about what the landscape of abortion access in Guam currently looks like. So the first is that interested residents must overcome three main barriers to receive medication abortion. The first, residents must meet in person with a qualified individual listed in the law and must be informed of the following. I submitted the Department of Public Health informed consent checklist, and I've asked AV to broadcast it on the screen for everyone to view. Thank you very much, and I'll just read a brief synopsis of it. So the patients have to be informed of the name of the physician who performs or induces the abortion, and a contact number where the physician may be later reached if the individual has questions. The individual must also be informed of any immediate and long-term medical risk associated with the proposed abortion methods, anesthesia and medication to be administered, the fetus's gestational age. And then they must be notified of alternatives to abortion and have been provided information concerning these options. And they also must be advised of the fetus's probable gestational age and to be informed about the anatomical and physiological characteristics of the fetus. And they must be given a description of the proposed abortion methods. In addition to this checklist, residents have to read the booklet titled A Woman's Right to Know. And in this booklet, I actually have a copy here, and I believe I submitted it to AV as well for submission for the committee report. And I can briefly touch on what information has to be shared during this abortion medication counseling. So the first is that we do need the probable gestational age, and what has to happen is that the resident has to read to themselves, or I read to them, what is their gestational age at the time they're receiving the medication. They also have to be informed of the paternity information that is also listed here on the booklet. They also need to be informed of what is child support services and the definition listed in the booklet. They also need to be informed of Guam's only adoption agency, the contact information to include the email and the telephone. And lastly, they have to be informed of the public health services that support child development, to include SNAP, Cash Assistance Program, Child Care and Development Fund, Medicaid, the Medically Indigent Program, and then WIC. This is just barrier 2. The last barrier is that individuals have to overcome the 24-hour waiting period. So 24 hours before anything can be done in moving to get the medication. And also, this is all on top of the fact that patients will virtually meet with one of the physicians from the Queen's Health Clinic in Hawaii, and they would have had an opportunity, the patient would have had an opportunity to already discuss their decision and get the answers to any questions they may have about the medication abortion with the physician telehealth in Hawaii. Senators, in my capacity as a licensed social worker, I have been providing all the information the statute requires to ensure that this service remains accessible for our community. But these medically unnecessary barriers do not need to exist. What I do not understand is why this existing law treats informed consent for abortion differently from any other medical care. Why is there a need for in-person counseling? Why is there a 24-hour waiting period? And why must we force residents to read this booklet? So this is the process where we're at now. And to be frank, the current state of abortion access in Guam is unacceptable. Our laws are archaic and burdensome. They place undue obstacles in the path of individuals seeking to exercise their fundamental right to make decisions about their body and their futures. They force people into desperate and dangerous situations, denying them the basic dignity and autonomy they deserve. But we refuse to accept this status quo. We refuse to stand idle as our fellow community members are denied the care and compassion they need and deserve. That is why our organization exists. That is why Family Rights exist. We exist to advocate the meaningful legislative change that will bring our laws into alignment with the views of our community and to ensure that every individual has access to safe and legal reproductive health care. Senators, we are not in this fight alone. The people of Guam are overwhelmingly pro-choice, and we saw this with the opposition against Bill 291 in the previous Guam legislature. The people of Guam understand the importance of reproductive rights and autonomy. They know that decisions about pregnancy and parenting are deeply personal and should be left to the individuals and their healthcare providers without any restrictions put on them by the government. And it is time for our laws to reflect these values. It is time for our senators, for our legislators to listen to the voices of the people they represent and to take action to protect and expand reproductive rights in Guam. We urge every senator in the 37th Guam legislature to support Bill 162 so that we can ensure that every person has access to the full range of reproductive services they need. At Family Rights, we believe that we can create a future where every person in Guam has the freedom to make decisions about their own bodies and their own lives without fear or stigma, and we believe that Guam will be a place where every person has safe and timely access to reproductive health care and a place where everyone can have full bodily autonomy. So we stand in strong support of Bill 162, and we strongly urge each and every one of you to support the bill as well. Sizos Masi.
Thank you very much, Ms. Lorenzo. Next on the list we have is Ms. Tatiana Rages.
Hello, Senators. I'm here in support of Bill number 162-37 because it takes away the provision of the current law requiring in-person counseling to take place before a pregnant person may receive abortion services. I believe that the in-person requirement for counseling is not always necessary. There is a lack of licensed professionals who offer the counseling services for abortion-seeking individuals on Guam, and the individual who does so only works part-time. Accessibility is a pertinent issue for pregnant individuals seeking abortion services. Teleconferences can help amend this issue. Advances in technology have made teleconferences an extremely accessible option. It is one that can help amend the limited services that are entitled to pregnant individuals seeking abortions. With this, pregnant individuals seeking abortions can at least get their foot in the door. Women at the early stages of their pregnancy will no longer risk delay that may result in the necessity of more extensive abortion procedures because they simply cannot get in contact with a licensed physician. So what I'm referring to is receiving a medical abortion, a pill or a set of pills, as opposed to a surgical abortion. With this amendment of the bill, these essential counseling sessions can occur much sooner. Now, I do believe the amending of this bill should be done in collaboration with licensed healthcare providers that can explicitly lay out the conditions in which telecommunication and distributing medical abortions, the pills, to patients can be done safely. What information is essential while remaining unbiased? How can we properly and safely take advantage of telemedicine? Evidently, there is a lot of work to be done because the range of services on Guam has been lacking for a long time. Ultimately, finding a way to effectively utilize these teleconferences will show all citizens of Guam that regardless of your circumstances, your bodily autonomy is rightfully protected. I would like to end by addressing the reality of our island's social climate surrounding the issue. Accessibility to abortion is at its core about bodily autonomy rights. Abortion is legal on Guam. It now needs to be equitably accessible to protect the bodily autonomy of all individuals, regardless of their individual principles or beliefs. Although it may act as a moral issue on an individual basis, it is not up to one person or one group's morality and values to dictate the bodily autonomy choices of any one individual. These choices should always and only be made by an individual with the assistance and guidance of their physician. It is a private matter that should hold no room for the biases of outsiders completely disconnected from the individual. I respect that my beliefs do not align with many others on this island. However, just as we are all entitled to hold different values, we are all also entitled to the same rights. Whether it be to have an abortion or pursue a pregnancy to term, just as it is my body, my choice, it is just as much your body, your choice. Let's have Guam work to make telemedicine a viable option to best support reproductive health and bodily autonomy. Thank you for my time.
Thank you very much for providing your testimony. Next, we have Mr. Don Eani.
Thank you very much, Senators. My name is Don Eani, and I am in support of the pro-life ladies who are requesting that you, Senators, do not pass Bill 162-37, and so I humbly request that you Senators rethink Bill 162-37 and not pass it in its current language. I want to call to attention that I continue to believe that these preborn, unborn babies are human beings and therefore deserve our consideration. They deserve for someone to deliberate for them and for the mothers to be informed of the issues so they can reflect and decide for themselves what they feel is the best option for them to take, action to take. I'm also here to speak in behalf of our faith leaders, our priests, our pastors, because they don't usually, they aren't actively involved in politics. However, they have our respect. The ratio of these leaders, I think, is thousands to one. So they won't be here to speak in behalf of the pro-life movement, but I think the majority of our leaders, priests, pastors, are pro-life, and they teach to Christians in the churches that to intentionally kill a human being is murder, which is defined by the Fifth Commandment. So at some point in our lives, we're going to have to ask ourselves, I think, either we believe we have a creator, and our creator has taught us that to kill a human being is a sin, or we don't believe that we have a creator, and this whole sin thing is BS. So at some point in time in our life, we're going to have to ask ourselves and honestly reflect, what do we believe? Bill 162-37 gives the impression of not supporting policy which would allow for a mother to be informed of all the options. So in effect, the impression is it would be biased in favor of the pro-abortion choice policies against anti-abortion, pro-life considerations. In effect, the impression is it would be a slippery slope where the envelope would continue to be pushed, where eventually what we have is an instructional of how to kill your baby. That's just an impression. I think I'm not the only one who has that impression. So again, I want to reiterate to the senators, please rethink Bill 162-37 and write it in a way which is somehow compromising to both sides, and allow for mothers to deliberate, to be informed of the issues, and to reflect what is in their best interest and what they believe to be the course of action that they want to take. Thank you very much for your time. Appreciate it.
Thank you very much, Mr. Kalani. With that, we'll have Ms. Agnes White to provide her testimony.
Hafa and good afternoon, Speaker Brown and Senators of the 37th Guam Legislature. My name is Agnes White. I've been a registered nurse for almost 4 decades, and I'm a registered voter in the village of Tamuning. I come before you today, as I did in September of 2023, to state my opposition to yet another bill sponsored by Senators Parkinson and Fisher, allowing abortion free reign through legislation to take the lives of innocent unborn children. Bill 162-37 intends, as stated on page 1, lines 6 to 7, we aim to update the legal framework for the availability of safe and accessible abortion services in Guam. Thus, you have submitted, which you have titled, an Act to Amend 3218-1 of Chapter 3, Article 2, Title 10, Guam Code Annotated, and repealing relative to updating the Women's Reproductive Health Act of 2012. An important information that was omitted out of this original Act of 2012 is information. It is called the Women's Reproductive Health Information Act of 2012. With that word foremost in mind, I would like to first address the word safe, which you stated so clearly in your introduction to this bill. Safe. Abortion is legal in Guam, so accessibility is not the issue at hand. Anyone with a license to practice medicine can hang up a sign here and perform abortions legally. Our present laws allow that. However, this bill you have introduced removes all sense of safety for the woman seeking an abortion. And how does it do that? Subsection B of the Women's Reproductive Health Information Act of 2012 dictates requirements for informed consent. It states no abortion shall be performed or induced without the voluntary and informed consent of the women upon whom the abortion is to be performed or induced, except in case of emergency. Consent to abortion is voluntary and informed if and only if, at least 24 hours before the abortion, the physician to perform the abortion or qualified person has informed the woman in person or through a virtual medical consultation of the following, and lists all the requirements. This bill, which you want to introduce, removes this 24-hour requirement and states it as a burden. Dr. Shay presented evidence-based information that 24 hours in situations like medical emergencies is not enough time. A woman with RH compatibility, he stated even given Rogran and getting lab tests. If you come in on the weekend, you won't get the lab test till Monday. Even the medication might not be available for the woman, posing big safety issues and life-threatening situations for the woman. So 24 hours restriction before performing an abortion is not restrictive. And as he stated, even more time is needed. Making a decision to abort one's unborn child, as you stated on page 2, line 18 in the proposed bill, is a deeply personal and complex choice. Should not the woman be afforded time to decide on the life of a child? This proposal simply allows the physicians to simply let the woman know right before an abortion what will happen. Furthermore, informed consent can be done virtually. As a healthcare professional, informed consent is vital and foremost in our work to ensure safety. My time as a registered nurse in hospitals in the state of Missouri and New York, have drilled into my head how important this is. Language barriers, as we all know, on this island can really confine our ability to obtain a good informed consent. And yet we say we will do it virtually. It was the physician who, if a physician was to obtain an informed consent on a patient who was to do surgery, as a registered nurse on the floor, it was the physician himself who informed the patient what was to happen, and it was witnessed by someone licensed. Even in an outpatient surgical setting, the doctor explains the procedure with ample time, and I mean more than 24 hours before the patient is to make the decision. So what situation would warrant a virtual medical consultation related to a medical abortion? What situation? Abortion is legal here. Anybody can hang their sign up, as I mentioned. Why would a medical virtual consultation be necessary? Furthermore, in your proposed bill of 162-37, there are several sections that you want to eliminate. The probable gestational age of the unborn child, the probable anatomical and physiological characteristics of the unborn child. Dr. Shay pointed out so well that learning the gestational age of the unborn child is necessary for the safety of the woman, especially if you are going to perform a medical abortion. There are restrictions on receiving this pill, the abortion pill. Restrictions on how big the baby can be, on the gestational age of the child, to ensure the safety of the woman. So safety is already thrown out the window by eliminating the knowledge of the gestational age of the child. Moreover, risks is involved when the size and the gestational age of the baby is advanced. The bigger the child, the more advanced the anatomical structures of the child will be too. And an abortion, having an abortion on a bigger child would mean increased risk for the woman. So eliminating these requirements certainly would render the safety of the women questionable. Now, Section B of the Women's Reproductive Health Information Act of 2012 is a lot about informed consent. What is informed consent? Informed consent is a process in which the healthcare provider educates a patient about the risks, benefits, and alternatives of a given procedure or intervention. So informed consent must address alternatives. Bill 162-37 throws all this out. Information on medical assistance, public services for the pregnant woman, printed material as described in subsection C, and this very important bill that 162-37 removes is information to let the woman know that the, quote, father of the unborn child is liable to assist in the support of this child, even in instances where he has offered to pay for this abortion. So it sounds like 162-37 gives deadbeat fathers a break. Now, how unpro-woman is this? The woman is supposed to receive this information according to the Women's Reproductive Health Information of 2012, at least 24 hours before the abortion. But this is eliminated. So where is informed consent? Informed consent is out the window. This gets even better because page 7, lines 3 to 5 seek to repeal the entirety of subsections B5, B6, B7, and B8. B7 requires that the physician shall clearly certify in writing the nature of the medical emergency and the circumstances which necessitated the waiving of the informed consent requirements. The certification shall be signed by the physician who performed the emergency termination of pregnancy and shall be permanently filed in both the patient records maintained by the physician and records maintained by the facility. You wish to eliminate this by this bill. When you eliminate situations like this where mandatory reporting of untold ramifications of a medical procedure on a patient is eliminated, things can be hidden very well. And you stated on line 7, page 2, the legislature aims to eliminate the risks posed by unsafe clandestine procedures. This is so contrary to what you say here, because mandatory reporting has been just thrown out the window. Any such behavior has been eliminated. So once again, we have a bill before us which is far from being pro-women as the ones in September. I urge you, senators of the 37th Guam legislature, to vote no on this bill, which continues to exploit women and kill their unborn children. Thank you.
Thank you very much, Ms. White. With that, we'll have Ms. Patricia Analon provide her testimony.
Hi there, my name is Patricia Analon. I write this testimony opposing Bill number 162-37. Dear Senators Brown, Aagui, Fisher, and Parkinson, after reading the bill introduced by William Parkinson and Thomas Fisher, I found many contradictions with their stated goals. So I made a rough chart to see things at a glance. I find their amendments contradict the overall spirit and purpose of the original act. Okay, So do you have this chart in front of you? Okay. So one of your first goals is to offer guidance to healthcare providers and compassionate care for individuals. So I'm asking you, how do you show compassion on a woman or any woman when the checklist certification is no longer provided to her? Doctors have less and less duties. They no longer retain a copy of a checklist certification in a woman's medical file, and doctors no longer certify in writing the nature of an abortion in case of a medical emergency. Also, the entire Section C, subsections B5, 6, 7, and 8, they all deal with the physicians having less and less duties. Your second goal, which is to uphold the right to privacy and ensure freedom of choice. If you look on Section 5, subsection 6, you want to remove that saying that says, and in a private room. Yes, going through an abortion is very private, just like exposing somebody's bank account statement. That kind of stuff is very private. I think that should remain there, not be taken away. Your third goal was the right to make informed decisions. Okay, so Section 4, subsection B. How can a woman truly make an informed decision when printed materials for her to read or a chance to talk to anyone about the questions she may have at least 24 hours before the abortions, when that's not going to happen for her? That step will be deemed not necessary if this bill passes. And under Section 7, subsection 6, it relates to printed materials that will be deleted. Okay, so she needs information. She can't really get it on her own. People need to hand out her information. If they truly are supporting her, they would give her information instead of stopping it coming towards her. So your goal, number 4, providing qualified medical professionals. I have no objection against that. Your goal number 5, which was equal access to productive services. I have no objection against that one. Your goal number 6, which is to empower individuals to make informed decisions. So that's the same as goal number 3. All of Section 3 will be removed. That's quite a bit, and subsection B2, no virtual medical consultation will be provided to women about medical access, benefits, the printed materials. She won't know anything about public assistance that's kind of like medical insurance, and nobody's going to be there to inform her or knowing about there's adoption services. And then she doesn't have the information that won't be provided to her about the description of her unborn child. Maybe she won't even know that that the father could have a stake in this to provide support for the unborn child. So the goal number 7, which is respect and safeguard the right to religious freedoms. I have no objection to that. So, senators, basically all I really know and get from this whole thing is that when we withdraw information from women, that will not be supporting that woman and her unborn child. So I ask you to please vote no in this bill, and thank you.
Thank you very much for providing your testimony. And the last individual we have listed that is signed up to testify is Mr. Ray Kinata.
Kind of new at this process. Senator Brown, Senator Parkinson, Senator Fisher, and Senator Taitagui. Thank you for the opportunity to share this morning or this afternoon. I am a Christian pastor and missionary to Saipan for 35 years. So I've been gone for a while, and I've just returned. And one of the things that has been a real concern has been the state of abortion on the island. I remember Senator Elizabeth Viola and her bill that went to Ninth Circuit, and that was in the midst of Roe v. Wade. And I heard that there was a lot of controversy and a lot of money and suggestions that she not do it because, there was going to be it would be rejected anyway. But she went ahead and filed it, ADA approved it. And that was a time when there was a clear statement in the community that we are for life. And that was something I was very, very proud about. I tell you, I was in Saipan, and as a missionary, I heard about this, and I'm telling you, I said, wow, that was awesome. And I realized a lot of things have changed. And that has been a big concern, and bear with me, been a big concern. And so I don't like coming and testifying. That's just not one of the things I like doing. But I felt I really needed at least to say something. And I appreciate all the details. You ladies have done some phenomenal research, and you guys have dealt with all the details. And all I can say about the bill is that, when it was first introduced, actually the two bills before, the one concern that I had was in light of the overturn of Roe v. Wade and the opportunity, that Dobbs gave the community. We actually had an opportunity, to write our own bill on life. And obviously, the currents have changed, the tides have changed, and there's no longer a great stand with Elizabeth Viola introducing a radically pro-life bill. So I am concerned that the whole community is not given an opportunity to vote. And so one of the things that I supported, I did not like so much a lot of the details in the bill, but the one thing I definitely liked was the introduction, which said that, this is a very sensitive, it's a very important issue. It's an issue that the community, is going to have long-lasting impact. And this is something that is close to the heart of the people of Guam. And I felt that because of the overturn of Roe v. Wade and because of this true opportunity to be able now to really write a bill that is going to respect, the values that we have as a culture. Now, again, I may be wrong, but I think there's still a whole lot of citizens on the island that are truly pro-life, and they would stand and they would, speak out. I have to be honest, I don't know for sure because, again, I've been gone for a long time. But I want to say I support that. Let's have an opportunity for the people to vote. You know, let's not just rush it through, and let's not just kind of take away and remove all the obstacles and just kind of impose a bill. Let's really, if you want to know what the community desires, let's have a referendum and put it on a referendum and vote. This is, to me, an issue that important. And so, why don't we? Well, that kind of got thrown out, I guess. So I want to say again, I think that that's something that we should consider. You know, if you really want to know what this community desires, put it on a referendum and let them vote. Okay? Now, one of the things I noticed about the bill, this bill, 16237, as compared to the two previous bills, was, you know, it seemed like it was removing everything that was holding, you know, abortion in check and just brushing it away and trying to fast track, you know, abortion and make it as easy as possible. And I said, that cannot be. I was honestly quite shocked. But that is the case, and I feel that that is something that honestly is terrible for our women, for our community, and fatal for the unborn child. And so I wanted, instead of going into a lot of the details that, you know, of the bill, I want to shift back and just focus on the child. See, we're talking about the women, we're talking about the doctor, talking about, you know, all of that. But how about this unborn child? Does that child have a right? Or have we just brushed him off? What is this child in the womb? And I'm trying to wrap my head. I have, you know, 3 daughters, and you know, I have a wife of 50 plus years, and so I love women. And I support women, and I want the best for women. I want them to have, you know, the ability to get any job they want. They can go to education. I mean, all of that. But when it comes to abortion, to me, it doesn't make sense. A mom to kill her own child? I'm trying to get this in my head, and I'm trying to work it, and I'm saying it does not. Something's wrong with that. And you know, I've heard all the arguments, but there's just something about that I'm saying is not good for, of course, the child. I don't think it's good for the women, and neither is it good for a community to just simply discard life. Now, is that baby in the womb deserving of the rights, the protection? See, the old bill had at least all these fences up. You know, you threw up the fences to try to make it harder, maybe, or to pause, to stop the process. You know, you're in a crisis, a woman's in a crisis, and she just wants to get something done. Well, these barriers were kind of like, you know, fences that said, wait, let's not rush into this. We're dealing with a child. let's pause here. Let's not just rush into this. We're talking about your baby. And I don't know why that doesn't click. But it's something that as a Christian, as a father, as grandfather and great-grandfather, as one who wants the best for our children and the values of our culture, for any other reason, just for the fact of, is this what we want for our culture? I'm not convinced it is. I say, keep the barriers up, at least. At least keep the barriers up and let at least that pause, that stepping back, that reconsidering, so that an opportunity, there's help, there's support, there's information. Let's keep it. One of the things that bothered me so much about the bill was it seemed like all those barriers were being thrown out. I'm saying, why? No protection for the baby. The pause is gone. Okay, so I believe that human life starts at conception. That means from conception right on through. And honestly, again, I'm trying to think, what is the difference between day one and 9 months later and 1 day after birth? I've got some pictures that I worked very hard to put in a poster. In one sense, to kind of celebrate the beauty and the mystery, the miracle of life. Truly is a miracle. And you see it through the development. And I'm going to ask you also to bear with me. I want to show one picture that I came across recently from the Center for Bioethical Reform by Greg Cunningham that shows the babies aborted. And I want us to look at that. And I want us to ask ourselves, that's okay? That's not violence? There's not something wrong with this picture? I want us to step back and pause. I honestly want time. I want us to give this community time. I mean, really sit down and think this thing through. And ask ourselves, what do we want for our community? I love this community. You know, my sons and my daughters calling me back to the States and saying, come and stay with us. We got this nice piece of property. I says, I can't. This is home. I love the island. I love the people of this island. I care about this island. I'm retired, but I want to serve. I want to help. This island community special. So I'm going to close. So just bear with me, okay? I work hard on this. Ask me, why were you late? Because I was working on this. I'm also a photographer, so that's one of the reasons bear with me. That's the baby. Amen? Now, That's a human being. 6 weeks. But really, way before that, at the moment of conception. This is a baby. You know? And because we're dealing with a baby, seriously, we need to step back, we need to pause, we need to ask ourselves, just stuff it out. Life is a miracle. Yes. Every single life is a masterpiece. You know what a masterpiece is, right? One of a kind. Not another one in the whole world. Past, present, or future. Every child is a masterpiece. There's not another Ray Kinsella. Past, present, and future. I'm it. That's special. Every child is a masterpiece. We cannot just snuff them out and push them aside, and especially the violence of abortion. So I'm going to ask you, bear with me, and this is a picture that caught my attention, I tell you, shocked me, and caused me to really get involved as I've never been involved before. And so I am working very hard, amen? Because abortion is wrong. It's violence. It's killing an innocent child. Your child. We need to step back. The way that the pace of the bills were going, I felt that the pause, the breaks, the thinking, the reasoning, really, let's take a look at this. Let's really understand what it is, truly, before we lock up this bill. I really don't believe that this bill, especially with all the amendments and deletions and everything else that took all the restraints away, is good for anybody. I would say leave all of that in and pause. Let's look at the election and let's find out what our community truly wants. Let's get a vote. Amen? I will tell you this, though. It doesn't matter what the vote says, the results of the vote. I personally, I'm committed to life. Amen? And I will not stop. I will do everything I can to try to help so that women have an opportunity to step back, pause, get help, and experience the joy of motherhood. Amen? Okay, thank you very much.
Thank you very much, Mr. Kinsella, for providing your testimony with that. Colleagues, Senator Parkinson, do you have any questions or comments for the panel?
No, I do not, ma'am.
Senator Tom Fisher?
Yes, thank you, ma'am. I think, I guess observations and questions would be that I would put to Ms. Flores as well as Ms. Lorenzo. This bill, as proposed, I mean, if you look at 3218.1 as it is, it's not amended, it's fairly odious. I think people would agree. I look at the bill that we're trying to get rid of this, and one of the sections we want to strike out is the probable anatomical and physiological characteristics of the unborn child. I guess the first question would be to you, Ms. Flores. A woman comes in to a abortion provider. Presumably, she's reflected upon her decision. It's nobody else's business, clearly. Why would can you think of a reason physiological characteristics of the unborn fetus is relevant? I know you're not a physician, but
I'm not a medical provider, but the provisions that are outlined in the 2012 Reproductive Health Information Act, I'm going to liken to if you break a bone and you go to a doctor and they have to perform surgery on you, the first thing they're going to do is take an x-ray to determine what's going on with the bone, how they need to fix it, what they need to do. Okay. And so one would presume, I mean, I've been pregnant several times in my life, and one of the first things they do is they either ask you for the first date of your last period, and if you know it, they go from there. If you don't, they will do an ultrasound. So likening it to a doctor who is going to fix a broken bone, you don't legislate that they have to do an x-ray. That's a medical procedure that the doctor already has to do because they went to medical school and that's just what they do. So one would presume that if you are a doctor and someone comes to you and wants to terminate a pregnancy, first thing you're going to do is find out how far along they are, because you can only, medication abortion is only under, I believe, 12 weeks. And after that, there are other things that happen. And then with Guam, our law prevents you from terminating a pregnancy over 13 weeks. So the doctor is not going to break the law, I would presume. And so within the confines of determining, I mean, no one has ever told me when I was pregnant, you know, okay, you're 6 weeks along, this is what your baby looks like at 6 weeks. I mean, you know, because I wanted to be pregnant, I looked it up, but doctors don't, as a rule, tell you that unless you ask it. So I would think that that would not be medically necessary. Ms. Lorenzo might be able to, because
Ms. Lorenzo, do you have a comment?
You know, Senator, I cannot comment too much just because I'm also not a medical provider, but what I can say is that the individuals that I do meet with, I always provide a disclaimer that the information I'm going to provide is not something I produced. It's not something that the Hawaii clinic has produced, but the information I'm going to provide is actually in the Guam law, and I actually have a copy for the patients to view. It is their right to ask what the Guam law looks like, so it is outlined there that, you know, of course, the probable gestational age, what are the risks. I also have to share that one of the risks is the subsequent to carry a future fetus to term. So there's this whole booklet, Senator, and all the senators here will have a copy of it for the committee report, but this book has a lot of information for these patients to read.
Okay. All right. Thank you for the answer, both of you. As I look at the unamended bill, it's replete, as I observe it, these are just one barrier after another placed in front of people seeking health care based on an opinion which is frankly irrelevant. For example, public assistance may be available to provide medical insurance and other support for the child. Why are we talking? Can you think of a reason, Ms. Flores, why we would be talking about, in a consultation for abortion, why we would be talking about financial support for the child and medical insurance? Is there
This act was passed in order to put up barriers to abortion, and that is one of them, is to try to guilt the person who has decided to terminate a pregnancy into not terminating the pregnancy. That would be
okay. I'm sorry, ma'am, but would it, as we go through the bill, it also says the doctor, I suppose, has to inform someone of public services to help facilitate the adoption of her child. You use the word guilt. This seems to be specifically designed to engender a feeling of guilt and shame and regret in a person making a personal private decision in which the state has no business as to her own health. Does that appear to be a barrier as well?
That's a fairly accurate description, yes.
Okay. Probably, I mean, we could walk through the whole bill and just come up with one barrier after another. There is also a phrase that women, I'd like to hear what your opinion on this is, that women seeking to terminate a pregnancy, they must be told that the territory of Guam strongly urges you to contact the resources provided in this booklet before making a final decision about abortion. First of all, I don't remember the territory of Guam ever making that decision, but assuming it did, could you explain why that would be relevant?
Again, I think that this act was enacted into law in order to prevent or to try to prevent women from having an abortion. One of the ironies of one of the parameters in the 2012 Act is that trying to talk to the person about that the father of the child can be made to provide child support. Well, if this pregnancy was a product of rape or incest, that's abhorrent. That you would want, that you would want the father to, because first of all, we have a rape custody survivor act that, well, the father has to provide the support anyway, even if there's no contact. But again, the decision of when and whether to terminate a child is, or a pregnancy, I'm sorry, is not something that should be a group decision.
Okay.
And that's what we advocate, is that it's a personal decision, and it's different for every single person. It's, you know, whether to terminate a pregnancy is a decision that is not something that should be subject to the entire island or any entity other than that person.
Yes, ma'am. Well, you know, following up on your observation, I know you're familiar with Senator Raphael Warnock's comment that in the room, the physician's examining room, there is room for the patient and there is room for the doctor, but there is no room for the state. So the decision remains solely within that person. This is, you know, again, there's lots of barriers here, but I think this is among, I used the word before, this is probably, and I'd like to hear your comment on it, probably the most odious, offensive of the requirements. Printed materials that inform they're required to give this to the lady seeking health care. Printed materials that inform the pregnant woman of the probable anatomical and physiological characteristics of the unborn child at 2-week gestational increments from fertilization to full term. So repeated, constant visits to the physician is required, including color photographs of the developing unborn, we keep using the word child here, but that's just the pro-life community propaganda. It's an unborn fetus, at 2-week gestational increments. What in heaven's name is that for, other than to guilt, offend, and interfere with fundamental private right? Well, you don't have to comment on that. And I'm just going to wrap it up. I know it's been repeated 1,000 times, but you know, Secretary at that time, she was First Lady of the United States, Hillary Rodham Clinton in Beijing, said, I think in 1992, that women's rights are human rights. So we're not going to, the idea of disenfranchising 51% of the global population is, I don't get it. Very few people do, I think. But thank you very much. Thank you for everyone who testified, and thank you very much.
Thank you very much, Senator Fisher. Senator Terlaje, you have any questions or comments for the panel?
Thank you, Madam Chair, and thank you again, everyone, for staying late and behind, wanting to testify and being here. I really appreciate the pictures that you showed. It was very difficult to watch. I noticed some of the people who are in support of this legislation couldn't even look at the picture when you held it up. It goes to show you that it's a reality. Those pictures, it brings it to reality when nowadays the next generation is only used to Twitter and Instagram. Anything that's longer than 5 seconds is, or if it's not a picture format, they don't pay attention to. So that was very real, what you provided. Thank you for taking the time to do it. And I love your, of course, Agnes, your information that you provided, very accurate to a T. Thank you. And yes.
Thank you. May I say something? The question Senator Fisher had for Ms. Flores, and yes,
sure, go ahead.
As a medical professional, I'd like to address that. And it's sad that you didn't ask Dr. Shay, who was here, who went into the medical aspects and the complications, mode of pregnancy, ectopic pregnancy, and explaining those. So those could have been qualified had you asked him those questions.
Yeah.
And the necessity of having lab work on the woman done, and the complications and what he sees on this island, the high incidence of thalassemia on Micronesian women, et cetera, et cetera. He is the subject matter expert that should have been addressed to answer those kinds of questions.
Right, and he walked out during that time.
I'm sorry, but...
And as far as this, unborn fetus, it's really an unborn baby, period. Plain and simple for everyone to know. It's not an unborn fetus, it's an unborn baby. So I think that's totally inaccurate, and he has his opinion. He can have his opinion, but, to say that, it's a pro-life group saying, unborn baby versus unborn fetus, no.
Right.
I believe it's an unborn baby.
And to address all the information that is necessary to give the woman, that is necessary for informed consent, which you state here is very important.
Right.
Safety, accessibility is there. Informed consent involves also giving alternatives to the procedure to be done. How can it be informed consent? You're just giving a one-sided picture. That isn't informed. It's like you are shoving this option, and how ironic. You are the program of choice, but there's no choice given. Only that one choice, an abortion.
Information.
How truly sad.
Right,
yes.
and information
is empowering, and that's what you have to give to the women.
Very
so
well
they can
said.
make an informed decision. And you've just withheld all this important information. Truly sad.
Very much. Thank you. Thank you. It's so true. Information is powerful. It gives a person the right mind on a decision they have to make that can affect them, down the line. We talked about the mental state of a patient, not just the physical perspective. And for familiar, right, with Stephanie, when you thank you for testifying today, coming forward. You had a lot of why this and why that, focus on why is there a need for a person counseling, why is there 24 hours. Well, if you heard the statement, I hope you take the chance to listen to Dr. Shay's statement. He pretty much answered all your whys. And this is coming from a professional. You sat there trying to answer questions that only really a professional should answer. giving your opinion is one thing, and I'm glad that you mentioned you are not a professional, but this is your comment, and again, Jane, coming forward as the director of the Women's Bureau, you do not represent all the women on this island.
I would just like to correct one thing.
Okay, I'll give you a minute if you wanted to say something.
Stephanie is a professional. She is a licensed counselor.
Oh, she's a licensed doctor? She's an OBGYN physician?
She is a licensed counselor.
A licensed counselor, yes. But not an OBGYN doctor, not a person that oversees abortions, that have to deal with, actually performing it. And how long, Stephanie, have you been a counselor?
Senator, if I may, I'm actually, if you would like, I actually have a copy of the Women's Health Information Act of 2012, and it does indicate a list of providers, practitioners that are able to provide this medication abortion counseling, and it does indicate licensed social worker. I have been a licensed social worker since last year, but I have been, yes, because I'm very young in my field. I'm only 24, but I have dedicated my entire career to public service, whether it be in public policy in the Guam legislature, at the executive branch of government, and I currently serve in one of the GovGuam agencies in my primary job. But it does, I do have a license. Maybe not a medical practitioner, but under the Guam law, I am, under the Women's Health Information Act, I am licensed to provide this counseling.
So as a social worker, you know the importance of information to give to your client, especially to get them to know exactly what they're getting themselves into. You think that's important?
Absolutely, Senator. Okay. One of the principles of social work is the right to self-determination and the right to bodily autonomy. And something I've learned in my social work program is our professors always, they always stress the importance of, you can give them all the information accessible to them, but at the end of the day, it is their decision.
Exactly. And that's all this bill does. It just allows that information to be provided to them. And in your first year of or almost a year now as a social worker, I'm pretty sure that's very important. I mean, you don't need to be in there for 5 years to know the importance of information, because that's power. It gives power to that individual to make a sound decision. So when you sleep at night and walk away, and after you giving all that information to that individual and they make a sound decision, that should make you be able to sleep at night. As far as Women's Bureau is concerned, again, Jane, I've mentioned that, you do not represent all the women on this island. Your testimony in support of this, I'm just really surprised. It should be unbiased. Because if you're taking the director of Bureau of Women's Affairs, it's just so disingenuous.
I represent the administration of the governor and lieutenant
No, you
governor.
represent the women of this island. You have a duty and responsibility to all the women on this island, Jane, not the governor. So are you going to tell somebody who's the director of public safety that, the governor is saying, no, we only want to protect this type of group of people? He's not going to do that. He has a responsibility to the full society of this island and help everyone. So for you to come here and say, no, I just represent the governor, then you should not be the director of the Women's Bureau. You should be her special assistant and come here. Come here in your own capacity as an individual.
We advocate that every woman needs to be able to make their own personal choice.
That's not, according to this, you're supporting a bill that doesn't allow that opportunity for women to actually make a sound decision. A sound decision. Even with the comments made from the chamber, at least they understand the importance of information being provided. So I'm just, again, very disappointed.
And
as far as your example is a broken bone, using a broken bone versus killing a baby, it's not the same. A doctor giving information, if you break a bone, you get an x-ray. This is killing a child. It's a whole lot different than that. So it's kind of a bad of analogy. So
doctors do determine the age, the stage of the pregnancy before they would give the medication abortion. That much we do know.
Yep, and that's a lot of good information to let anybody know how far they along, how badly it's done. But
the issue with this act, Senator, is that it does not provide access to all women, because if you cannot avail of in-person counseling, then you cannot make an informed decision.
I think Dr.
So
Shay addressed
the
that.
The fact is that
I
it should
understand you
allow
have points.
for
Excuse
telecounseling.
me. I know you have points to make. I don't want to turn this. We've got through several hours without a debate.
Well,
I
I'm
understand,
sure Dr.
Senator
Shea
Titagui. I
mentioned that,
understand.
Madam Chair, and
You
I think I'm just going to leave it at that. That
Senator
you know,
Titagui, you are free to complete your comments.
Yes, thank you. So Dr. Shea did mention that information that you had, and again, I ask you to listen to what he had to say as a professional in the field. And I thank you all. Tatiana, thank you for coming back again. Good to see you. And I'm glad that you did make that comment that this bill should be in collaboration with a medical professional in moving forward. You made that statement. I was very surprised, so I appreciate you making that statement. Okay, other than that, again, I appreciate everyone's time. I'm sorry it's so late, but thank you, Madam Chair.
Thank you very much, Senator Titagui. Certainly thank you to the panel. I know we've run over our time that was originally scheduled at 5 o'clock, but I wanted to allow everyone to have the opportunity, regardless of what your position was on this issue, to be able to make your statements to the legislature and to the senators that were present. So thank you very much. We do have one more individual that has a late sign up, but we'll certainly listen to the testimony. Callan Meno.
Hello, good evening. My name is Kaylin Michael Meno, and I am here to testify in support of Bill number 162-37. I support Bill number 162-37 because the law as written impedes on my right to bodily autonomy due to a number of the requirements for informed consent to be manipulative tactics to dissuade a pregnant individual from receiving an abortion. Bill 162 addresses these issues by removing the manipulative language from law. Per the Center for Reproductive Rights, informed consent to abortion does not include biased or directive counseling or the forced provision of information that a woman does not wish to be informed of, and this includes the probable anatomical and physiological characteristics of the fetus at the time the abortion is to be performed. Additionally, I do believe it is manipulative to require that a patient is to be informed of possible medical benefits for prenatal care, childbirth, and neonatal care, possible public assistance to provide medical insurance and other support, public services to help facilitate adoption of the fetus post-birth, and description of the fetus, as well as paternal liability to the fetus post-birth. I reaffirm my support for the passage of Bill number 162, and I urge you, Senators, to please vote yes on the bill.
Thank you very much, Ms. Meno. Colleagues, do any of you, Senator Parkinson, do you have any questions or comments of Ms. Meno?
No, I don't, ma'am.
Senator Fisher?
Yes, ma'am, I'm sorry, your last name?
Meno.
Meno? Ms.
Yes.
Meno, I agree with you 100%. Thank you for your testimony.
Senator.
Just to say thank you for coming and testifying.
Thank you.
Yes, Mr. Kalani?
May I make a comment?
Sure, we'll allow you to make a comment.
Thank you. In regards to the questioning of why, the questions of why bring these issues up, to my understanding, the question of how, regarding economic issues, the supporters of pro-abortion choice supporters ask, how do you plan to help a mother to pay for her baby economically? So, to my understanding, these questions have been brought up. How do you plan to provide, services, economic assistance? So, I don't think it's really fair to say it's guilting a mother into not killing her baby. I think these are past questions that have been asked, that have been brought up in the past, and so they were addressed. How do we plan to help a mother take care of her baby if the mother decides to have her baby and not have an abortion, killing her baby? So I just want to make that comment. Thank you.
Thank you very much, Mr. Kalani. Some of you already that are present here provided testimony, written testimony, but I'm just going to read for the record those that we have received written testimony from. If you have additional written testimony, by all means, if you're here, please provide it to the speaker's staff. We have in opposition Ms. Alisa Perez, Marjorie Benedictus, testimony from Mark Beneventi, of course Shannon O'Connell, Joshua Gual, Gregory Calvo, Maria Moffness. We have testimony and support from Elaine Salisbury, from Jane Flores from the Bureau for Women's Affairs, from the Guam Women's Chamber, from Callan Michael Meno, who's here to testify, and also from the Famalawan Rights, Stephanie Lorenzo. We've also received testimony from Marilu Martinez in opposition. We've received testimony from the Archdiocese of Agana in opposition to Bill 162, from the Most Reverend Romeo Conovacar, the Apostolic Administrator. Of course, we have the testimony in opposition from Ms. Agnes White, and also from Patricia Analon, who is also present here, who's submitted written testimony. As I mentioned, if there's anyone else who would like to provide written testimony, we certainly welcome that. Before I complete my comments, I certainly want to allow the sponsor, Senator Parkinson, if you have any closing comments you would like to make.
Yes, Madam Chair, thank you. As part of my closing comments, I'd like to read into the testimony, written testimony by Dr. Shandini Raidu, MD, Masters of Public Health, Associate Professor of Division of Family Planning, Department of Obstetrics, Gynecology and Women's Health at the University of Hawaii, John A. Burns School of Medicine, as well as our colleague Bliss Kaneshiro, MD, also a Master's in Public Health. Hafaday, Speaker Terlaje, and members of the Committee on Health, Land, Justice, and Culture. Thank you for the opportunity to submit testimony in support of Bill 162-37 to include virtual telehealth counseling as an option for people seeking abortion care in Guam. We are obstetrician gynecologists with subspecialty training in complex family planning and abortion care. We have been providing medication abortions via telehealth since 2016 across the Hawaiian Islands and since 2021 to the people in Guam. We are committed to ensuring access to all reproductive health care options for people across the Pacific. We understand that Guam requirements for in-person counseling was passed into law before telehealth services were available. Since that time, however, telehealth has become widely used across many specialties in medicine, especially since the COVID-19 pandemic. It has been well documented in research studies that telehealth is a safe, effective way for people to access medication abortion services. People also find telehealth to be acceptable and sometimes even preferable to in-person visits because they're able to maintain privacy in their healthcare decisions and can attend appointments in the place where they feel most comfortable. Since people in Guam cannot access abortion care on island, the requirement of an in-person visit in addition to their telehealth appointment with us is an added and unnecessary burden. Passing this bill and acknowledging that virtual telehealth counseling is safe, effective, and a reasonable way for people to access abortion will alleviate this burden and allow people to access the care that they need in the way that they choose. Thank you for your consideration of this testimony. Shandini Raidu, MD, MPH. Bliss Kaneshiro, MD, MPH. So, as for my closing comments, when I introduced this bill, and really a lot of my guiding principle as a legislature is the cause of freedom. That is the number one principle I look at. What is the ways we can maximize freedom for as many people as possible to let people live and let live and make the decisions on their own. The principle of freedom has two parts to it. Two distinct parts for me anyway. The freedom from and the freedom to. In this subject, we are talking about the freedom to have access to health care, to abortion, in a timely and reasonable manner. And the freedom from is the freedom from unnecessary roadblocks and harassment when we are exercising our rights. This bill is removing the things that violate both of those principles. We talk about emotional damage and how we need to manage that. Well, I'm glad that was brought up because emotional damage and coercion is exactly what we're trying to remove from these bills. These bills are using time and emotion as ways to get people to change their minds on decisions that they came to on their own. And we're also violating this principle by putting unnecessary roadblocks for people to access their health care. We are weaponizing red tape and emotional coercion, and that needs to stop. Removal of these requirements does not mean these things disappear. They are just handled between the doctor and the patient as they should. The country made a mistake not enshrining Roe v. Wade into law when they should have had. They had very many decades to do so. The Supreme Court has said that they refer these decisions to the states and the territories. As long as I sit in this legislature, I will not make the same mistake the country has made and let this question go unanswered. I fully intend to enshrine these laws and make it known to the world that Guam is a pro-choice island, and we always will be. And with that, I yield the rest of my time. Thank you, Madam Chair.
Thank you very much, Senator Parkinson. For those who have testified orally or have not yet testified, the committee will continue to accept written testimony on Bill number 162-37LS for the next 5 working days, up until February 19th, 2024. Testimony can be emailed to Senator Terlaje Guam at gmail.com or hand-delivered to her office here at the Guam Congress Building. With that, it's 6:12 p.m. On February 12th on the evening. Thank you again to all of you who have taken the time to come and testify, and certainly thank you to Speaker staff and to all our staff here at Central of the Guam Legislature that have stayed the additional time to accommodate the testimonies for the hearing here this afternoon. With that, please have a safe evening. Thank you, and this concludes this hearing on this bill, on Bill 162.